Well, good afternoon, everyone. Thank you all for joining us today, both people in person here in New York and those watching via live stream. Welcome to this important convening on the margins of the 69th UN Commission on the Status of Women. This year marks the 30th anniversary of the Fourth World Conference on Women and adoption of the Beijing Declaration and Platform for Action in 1995. It is also now 10 years since the 2030 Agenda for Sustainable Development and its Sustainable Development Goals. My name is Tewodros, and I'm with the Global Center of Health Diplomacy and Inclusion, or Cehdi. We've organized today's first session along with Citizen News, the Women's Global Network for Reproductive Rights, and the Sexual Health and Rights Initiative. I will be co-moderating the following panel with Dr. T here, where we will be welcoming this brilliant group of SRHRJ experts and advocates to share their perspectives. So it is clear, very clear, that the world is not on track to deliver on Sustainable Development Goal 5, which promises gender equality by 2030, where no one is left behind. And whatever progress has happened towards this goal and the Beijing Declaration of 1995 is threatened by the global anti-rights push that we are seeing today. So the regressive Geneva Consensus Declaration, the Madrid Commitment, and the gag rule or Mexico City policy are only a few examples of this violent curtailment of rights and bodily autonomy that we are seeing. And a lot of the language surrounding this moment we're in with the Beijing Plus 30 and the SDG review relies on stock taking and review. And of course, reflection will always be important and necessary, but our conversations cannot and will not end there. So I think it is necessary for us to communicate the urgency that we must act with in order to protect bodily autonomy and ensure that gender inequity ends with us. So after a brief opening, we'll request our panel of experts to make introductory remarks, and then we'll open up the room for discussion. So without any further ado, let me welcome Dr. Haile Jesus Getahun for some opening remarks. Dr. Getahun is Chief Executive Officer of Cehdi, a Geneva-based NGO working to drive sustainable and collaborative change for the right to health and global health equity. And Dr. Getahun served in the WHO headquarters for over 20 years and also served as the founding director of Quadripartite Joint Secretariat on AMR. So thank you, Haile.
Thank you, Biruk, and welcome, and thank you for coming. And this is an important session because we are at the crossroad. The assault on global health and the assault on the right to health is more than any other time. And this is a time that we need to unite. We need to find, solid ground to bring our voices and listen and make sure that everyone has the right to health, regardless of gender, regardless of sexuality, or where they are born. That is why the Global Center for Health Diplomacy and Inclusion was established in Geneva, basically to raise the voice of the Global South in global health negotiations. As you know, most global health negotiations are happening in Geneva. And the existing multilateral system didn't address the need of the Global South during the COVID pandemic. And we are still living with those tragic lessons of the COVID pandemic, where the Global South was neglected, was not benefiting from the health benefits that happened during the pandemic. So that is why, if at all there is another pandemic, at least for our kids or for their kids, that we need to make sure that what happened during COVID will not be repeated. So that is why we are working to enhance South-South partnership, to enhance like-minded multilateralism between North to South partnership by bringing governments to be the sole responsibles of the right to health, that the health is a right for every citizen that the government should take lead. And of all those, the right to sexual and reproductive health and rights is the corner and the founding for everyone and for us. So that's why we are here today, and we look forward to listen to you and then find a way to solidify and to strengthen our voice so that we resist the assault that is happening now on global health. So thank you very much.
Thank you, Hele. So now we'll welcome Dr. Tlaleng Mofokeng, the UN Special Rapporteur on the Right to Health, for her opening remarks. Thank you.
I have to use this for the people online, I think. Great. Good morning, everyone. And I'd like to firstly say good morning to our ambassador to the United Nations of South Africa, Ambassador Matu Joyini. Thank you very much for joining us this morning, and all of the delegates who are coming from the different organizations, and of course important UN agencies that have been key in the delivery of the right to health in many countries and many contexts around the world. And the question is, are we on track to actually realize the right to health and for gender equality? And as the current mandate holder in this current position and mandate, I can tell you that no, we are not on track. But none of you are not surprised, because you know, even with the 2030 agenda that we all set for ourselves as the common vision and a common work plan, that we are not doing well. So we cannot be surprised. But I think the question is then, what are we going to do about it? And the recent events in the world have really made my initial approach to this mandate of one being anti-racist and anti-colonial very, very important. And I no longer have to argue why that was important to use those frameworks when it comes to the right to health. In 2020, when I was appointed as a mandate holder, I had to defend that, but I don't think I have to anymore, which is unfortunate because it means violations of human rights have happened to a degree that people now get it, right? And human rights being an early warning system, I had hoped and wished that that work would have been able to be taken on, even by member states themselves, in how they approach firstly the pandemic, but also subsequent crises that are now grappling the world. Protracted war, genocide, various humanitarian settings because of the climate crisis, all of them impacting different people disproportionately. And we know on the basis of sexual orientation, gender identity, age, where you are born, there are many other various grounds of discrimination. We know that discrimination continues, and that's why human rights is something that unites all of us and not divides us. And we should resist and really push back harder on the idea that human rights is divisive. Human rights are the actual basis of how we can move forward with something in common as humans. And just to say that the work requires a constant analysis of power. None of us can come into this work or even imagine a world, a future world that is just, without a commitment to constantly analyzing power, how it moves and shifts through us as individuals, as it moves and shifts through our own organizations, but also at the multilateral system. And so it's important to understand vulnerability as a human right. Everyone has a right to be vulnerable. There are moments in life where any of us could find ourselves as a refugee for any reason. And that's why we should be concerned about the rights of refugees, whether or not you think you are a refugee. That's why we should all of us concern ourselves with the rights of women and young girls who need contraception, for example, or people who use drugs, who need support, housing, education, nutrition, and the like. So the idea that you can dislocate the right to health from other human rights it's impossible. And it's also good to remember that when you realize the right to health, you enable many other human rights, and therefore you can actually get to gender equality. And with that, I would like to hand back over to Biruk, who will then take over the session with our panelists. And we look forward to listening to all of you coming to this panel with amazing experience, and it feels like we are a reunion of sorts. Yeah, we've worked many times online with many of you over the years, and I think it's important as we pour back into each other's cup to recognize how tired we all are. And I hope that today can be that moment where we can all just stop and just take a deep breath and just re-pour back into each other's cups as we re-strategize. And the work only starts with this conversation, but it actually continues way after this has been done. So well done to you, Biruk, for bringing us together this morning. Thank you very much. And I'm gonna go back and sit there.
Thank you so much for that. I do want to echo what you said about human rights not being divisive, and the only way forward that we have. It offers a framework, and I'm very grateful for all of the requests. Ms. Dawn Minott from the UNFPA, Senior Advisor on Gender-Based Violence at the UNFPA, to share your perspective and remarks.
Thank you, Biruk. Do we talk from here or should we come to the podium?
If you could.
Good afternoon, everyone. Good afternoon. There you go. You're in the room. And for those of you who are online, that would be good afternoon or good morning or good evening, wherever you are in the world. Thank you for joining us. I want to start off by saying I greet you in hope. I think this time more than any time, we need to be hopeful, not just in ourselves as human beings and the capacity that we have to what I call bounce back ability, to be able to bounce back, but to be hopeful in the sense that we have put in place mechanisms and structures and policies and programs to tide us through difficult times. And I dare say that these might be some of the most difficult times that we've seen in recent history. So I'm Dawn Minott, the Gender Advisor at UNFPA, and it's my pleasure to be here to speak with you and to have this conversation. I think in many ways we're united by our commitment to health, our commitment to rights, or our commitment to equality, to gender equality. And so I just want to extend a special thanks, Your Excellency, of course, Dr. T, and to the organizers for inviting UNFPA to be here, and of course to be on this panel with these illustrious speakers to bring this conversation to you today. So I think before we can look forward to answer the question that is before us today, it's really to take a quick look back. 30 years ago, the ICPD Program of Action and the Beijing Platform for Action did something remarkable, and that is it placed gender equality and women's empowerment at the heart of development. These conferences established that a woman's control over her fertility is fundamental to all of her rights. The vision that also drives the 2030 agenda and the call for universal sexual reproductive health and rights, which is central to achieving SDG 5 on gender equality and SDG 3 on health and well-being. Access to sexual reproductive health empowers women and girls, leading to improved health, economic opportunities, and stronger agency. So I think it's important for us to celebrate the wins as a start, because we have made strides, and I'll just highlight a couple of those. So globally, maternal mortality has fallen by 34%, and this is in the past 30 years. Modern contraception use has doubled, and as a result, this has reduced the unintended pregnancy in adolescent girls. There's also a recognition of gender-based violence, and that's increased to the extent that there are 162 countries that have enacted laws against domestic violence. And perhaps I think the most significant step forward has been on SDG indicator 5.6.1. And this indicator actually measures a woman's ability to make her own decisions about her sexual and reproductive health. Initial analysis suggests that over half of married or in-union women are now in the driver's seat when it comes to these fundamental aspects of their lives. 56% means that 44% of partnered women cannot make these essential decisions about their own health care, about contraceptives, or about their sexual decisions. So I also want to just highlight some of the other challenges that we see in the space in terms of delivering on gender equality and human rights to health. And these include the fact that maternal deaths have plateaued, and inequalities in access to SRH services also persist. We know that gender-based violence remains rampant. We've got 1 in 5 girls that are married before they're 18. And a woman dies every 2 minutes due to pregnancy or childbirth. And in this day and age, a woman should not die giving life. But these are the statistics that we're up against. Maternal mortality decline has stagnated, even increasing in some regions. And I think when we bring in the race and geography, then we see that these are really stark determinants in this conversation, because women in sub-Saharan Africa are 130 times more likely to die from pregnancy or childbirth than women in Europe or North America. And when we look at the Americas, Afro-descendant women and girls face higher rates of obstetric mistreatment, contributing to significantly worse maternal health outcomes. So these inequalities sadly extend also to gender-based violence. And when you break that down by age, sexuality, race, and ethnicity, these all play a role to the extent to which women and girls are experiencing violence that is impacted or imposed upon them by virtue of their gender. So in answering the guiding question of today's discussion, are we on track? Dr. T already gave us the answer to that, but I think we all know this. So I want to recall a recent report that came out from UNFPA, which highlighted what I'd say is a very concerning trend, because the progress that we've seen or that we've made has largely benefited those who are already close to accessing SRH programs and services, which means then that the gap in terms of inequality to access is greater if we're reaching those who are already closer to service. So this is why we need to move away from a one-size-fits-all approach and really focus on reaching those who are furthest behind. Now that sounds like a catch-all phrase. We hear it all the time. Reach those who are furthest behind, which means you need to know who it is that is left behind and how far behind they are being left. So important to that then is having data. So the truly being able to advance SRHR, sexual reproductive health and rights, we need to have national data systems that have the ability to give us that clear picture of the who is being left behind. This means we need to make the investment in collecting data, but not just collecting data, data that's disaggregated by age, by ethnicity, by race, by disability status, by sexual orientation, and also to be able to analyze that data. What is the data telling us, and how do we use this analysis to inform our programs and our services? So looking ahead, we're facing some significant global shifts. I mean, we're facing them right now. We're living in the moment. And all of these are impacting sexual reproductive health and reproductive rights. We're seeing rapid demographic changes, which are unfortunately leading to increased population anxieties and policies aimed at controlling fertility rates. These approaches often undermine fundamental human rights and disproportionately target women's bodies. We need a fundamental shift, and this shift in focus is away from controlling fertility and towards empowering individuals and respecting their reproductive rights. Dr. T talked about the humanitarian crisis that the world is facing. That's also a major threat. It's critical for us to integrate SRH and GBV prevention and response into all phases of humanitarian response. And I say all phases, particularly at the onset of a humanitarian response. It's critical that SRH services and gender-based violence services be considered as essential, right up there with food and water. So we are at the early stages of the 5th industrial revolution. So we see there is more human-centric AI. There are advances in biotech. There's augmented reality. Yet the digital gender divide has prevented many women and girls from taking advantage of even the fourth industrial revolution. So I think in many ways this presents both opportunities and challenges for our work in the SRHR space. For instance, we know that new technologies can expand access to contraception and help address infertility. That's one opportunity. But we have to also be vigilant about the risk around mis and disinformation that's very well populated online, as well as the rapidly increasing technology-facilitated gender-based violence. So the more time that women and girls spend online to access services that become more accessible because of this industrial revolution that we're in, the greater their risk to violence that is facilitated by being online. We're also missing a growing concerning resistance on efforts to push forward human rights and gender equality. I was in a session with Kemi earlier this week, last week? There have been so many. And I said to that audience, I don't want to say push back anymore. I want to talk about push forward. And I think the more we put our energy and our efforts into designing and defining what a push forward strategy looks like, the less power we give to the pushback. So in that context, what's happening in the world around us is not happening in isolation. It's transnational, and it's trying to roll back progress on bodily autonomy, on SRHR, on comprehensive sexuality education, and protection from violence. But this is where I see hope. And I started off by greeting you in hope, because I think the more that we spend time in the what's not working well, the less hopeful we are. But a lot is working well. I think of the Indigenous women who are leading the charge for environmental justice and recognizing its deep connection to reproductive health and autonomy. And what that says to us is the power of cross movements. The silo approach never worked, and it definitely will not work in this time. So how do we work across movements? How about the young activists who are passionately campaigning for climate justice, linking it directly to reproductive justice? So we need to amplify these voices and recognize that sexual and reproductive justice is fundamentally intertwined with the broader fight for social justice. So as I'm coming to the end and thinking about our future, I think achieving SRHR and gender equality requires broad alliances, and I've made reference to a couple of those cross-movement opportunities, but also around resisting polarization, that the health system needs to be held accountable, and upholding bodily autonomy and advancing sexual reproductive justice. This demands a fundamental shift in resourcing SRHR. We need to put our monies in the places where the needs are greatest. Investing in SRHR is a powerful driver of progress. I'll give you an estimation from UNFPA, work that we've done, give us the information that if we have, if UNFPA estimates an $8.40 return for every dollar that's invested in family planning and maternal health in developing countries. $8.40 is the return on that investment. I think if we look at that over a number of countries and the amount of investments made in other areas, this investment would be worthwhile making. However, what we see in current health finance is inadequate. In 2022, less than 1% of global aid went to stopping GBV, and only 1% of health research focused on non-oncology female-specific conditions, and feminist groups average a mere $20,000 annually. And when you break that down into groups that are led by women of color, that number is even more desperate. So we must prioritize SRHR in health budgets, explore innovative financing, and direct more resources to women-led and feminist organizations. So I want to conclude with what I think is a call to action for all of us in this room, in the online space, starting off with financing. I think it's important for us to significantly increase international financing for sexual reproductive health and rights, for gender equality, and women's empowerment. There's a UN study, and my colleagues who are here from UNFPA will know that I more oftentimes than not will cite this study because it makes me cringe. It will take us 300 years to get to gender equality at the pace at which we are progressing. And I don't know about you, but that just does not sit well with me. So the investments are required to help us to advance more quickly. We need to use national budget processes for full SRH program implementation, including gender budgeting, and develop innovative financing and partner with women-led and feminist movements. I want to give an example from Panama. Again, UNFPA did a study on adolescent pregnancy and found that it would be around $525 million per year. And when we looked at that in the context of the economy of Panama, we made the link to shutting down the Panama Canal for about 3 months. That's what $525 million will do. When this information was presented to the government, it was an aha moment. Because oftentimes when we're talking about women's issues, it doesn't land very well. But when you link that to dollars and cents, that's when we made the connection. In Panama, these numbers persuaded the government to implement policies that would expand access to contraception. So the more that we can provide the evidence, the more that we're speaking to the right parts of government. I'm with UNFPA, more oftentimes than not, we're speaking with the Ministry of Health and the women machineries. But more and more, we're knocking on the doors of the Ministers of Finance, because that's where it really matters, right? Where the rubber meets the road. The second, I think, is leveraging the power of arts and culture. Storytelling, music, the visual arts. As you're doing SRH advocacy, the way that we talk about policies and programs from the perspective of UNFPA as a UN agency, I don't think it lands in all the right spaces the way that we would like for it to land. But when you put this in a song or you write a poem, it gives us access, it connects. And what you're trying to do is to connect to people's heart. This is a battle, I think, for heart and soul. This is not so much about resources, because if you had all the money in the world, but people's hearts were not changed and their minds were not changed, and all that money will not make the difference that we're trying to make. So I think it's important for us to try to reach to the heart and souls of people. And then the final thing is around addressing barriers. And I think data, as I mentioned before, is important for that, and having that data disaggregated. So in addressing the barriers, it's important, I think, to ensure universal health coverage, fulfilling SRHR at all life stages, and strengthening health systems to meet international standards. Also important to strengthen support for women-led and feminist organizations. As a UN system, as UNFPA, we are committed to the strengthening of women's movements to be more autonomous and working directly with women organizations as partners in their own right. We have committed 35% of our humanitarian funding directly to local organizations, including women-led organizations. That, I think, is important for us to continue to do. So in conclusion, the journey towards SRHR for all continues. By working together with accountability, recommitment, and adequate resources, we can create a more just and equitable world. So I invite us to renew our commitment to make the promise of ICPD and the promise of Beijing a reality for every woman and girl in all of their diversity in every place that they occupy. Thank you.
For contextualizing this moment, I think it's very important to highlight our gains that we have made, but also the health disparity that we do see, and the importance of coalition building is very pertinent. So thank you for that. Next, we will have Dr. Roopa, an associate professor at Georgetown School of Medicine and co-founder of Women in Global Health. Thank you.
Hi, everyone. Can I get a loud hello back? Great. I am so excited to be here. I'm speaking in my personal capacity. I know 2 institutions were put out there, but it's Roopa today. There is so much I want to say, but I think I want to open first by acknowledging this is my first public engagement since I went through a pretty painful, rough exit. You can learn all about it online, but what I'm here to do is actually leave you with 2 key messages. And it's great because we're building on each other. And for me, one of the goals in this talk is to give you all hope, because I'm feeling hope. The second is hopefully inspire all of you to collaborate differently, one that is bold, inclusive, and unshakable. This is a room that is going to be the future, and it's rooms like this all around the world. As I was walking in the streets of New York, this is the first time I've been in New York, and I'm not going into the United Nations. Rapporteur, please excuse me. I was thinking to myself, nor do I have a desire, because I believe the real change is happening in communities all around the world, and local communities. And that's where we need to be supporting. And I will be talking about that a bit. I have written some remarks because there's a lot that I'd like to say, so bear with me, but let's be hopeful and let's collaborate. So are we on the right track on delivering gender equality and the human rights to health? No, it's been said. And if I was the AI plus me version in real time right now, my speech would have been edited down quickly because the speakers before have said a lot of these key messages. But I wanted to emphasize that, you know, the timeline we're talking about is that gender equality is going to at least take 100 years or 400 years. I mean, these are ridiculous numbers, right? These are numbers that are not going to be in our lifetimes. It's not even going to be in the lifetimes of 3 generations. So clearly what we've been doing, acknowledge the gains, hopeful, but we got to change it up and we got to accelerate change quickly. And unless we take the bold action in our lifetime, we may not even have a planet where women will ever have equality because we know the planet is at risk. Since the 1995 Beijing Conference and Declaration, there's been undeniable progress. We've heard it. Girls are more educated, more informed, more determined than ever, but this progress is uneven. While some have gained rights, others are facing severe rollbacks. We're witnessing a gender apartheid in places like Afghanistan, which we would have never imagined. When I was a girl, and that was in the 1990s, in 1995, I was a young girl who never would have imagined we would have come back in the way that we are. We've prepared women for leadership, yet we have not created the enabling environments for them to lead and reshape the world on their own terms. We are all here today because we know we will not accept this fate. This room is here because we will not accept things as is. We want to achieve gender equality and women's rights in our lifetime. The real question before us is, are we willing to do things differently? I'm going to repeat that. Are we really willing to do things differently? Are we willing to adopt new tactics, work across differences and divisions, move beyond grievances, especially in the women's rights space and broader political arenas to focus on a shared agenda? And are we really willing to shift power? You know, why I like this room is because it's a Global South-led room. I was born in India, Global South runs in my blood, but I see sisters here from all around the world. And that's what I mean about doing things differently. I was asked to talk about specifically global health. Are we reducing gender disparity in global health? Yes, we are. But fast enough? No, not at all. We know that progress is stagnant, under attack, even reversing. We've heard a lot of it today with gains and losses, but let's highlight a few key areas. On leadership, if you want data, there's lots of fantastic reports out there by Women in Global Health 50/50, and many other groups. But the big picture is women's leadership is stagnant. In COVID-19, we lost ground. The numbers dwindled down into single digits of representation in places like the World Health Organization Executive Board, which is a member state or government role. We are stuck at the 25% ceiling, maybe 30%. And it's estimated it's going to take us at least 100 years in global health, even though 70% of the global health workforce are women. Policy. While some policies have become gender sensitive and even gender responsive and transformative, backlash threatens to unravel all these. Universal health coverage for women remains far from a reality. Women bear the highest out-of-pocket healthcare costs and are more likely to forego care due to financial constraints. According to Women in Global Health, women contribute significantly to the health workforce, yet they face systemic inequities in pay, recognition, violence, and access to essential services. Women may be living longer, and yes, I hear that all the time. Look at women outlive boys, outlive men, you know, what about them? But they're living poorer and sicker and carrying the entire burden of society on them. Ensuring universal health coverage that prioritizes women is not just a necessity, it's a fundamental human right. On health and rights, there have been some gains, I will skip the data because we have heard about it already, thanks to Don, especially on maternal mortality. We have gains, but these gains don't apply universally. We know how it affects Afro descent and Black women here in the United States specifically. We know access to sexually reproductive health has improved, but yet still women are lacking the ability to make decisions of their own bodies. Millions, and I would say actually billions, are lacking that. And the battle of bodily autonomy is here. It's the most contested fights of our time. While some countries have expanded to safe abortion and contraceptions, others are restricting them. Here in the United States, we're seeing the rollback state by state. It was a very hard one battle to begin with, but we're seeing it here just in our neighborhoods. And this reinforces cycles of poverty and ill health. Yet there are other areas that are gaining new traction. Women's health and life course approach, especially acknowledging taboo issues such as menstrual health, infertility, menopause, endometriosis. We're excited in the women's health community about how much more traction we're getting. Then I want to shift focus to the impact of the anti-rights movement on global and national health. We've heard a bit about that, and I really like your language, not about pushing back, but pushing forward. Anti-rights movements are gaining strength, directly undermining women's rights and health policies. Their strategy is clear: divide and conquer, and we face a two-front attack. Now, these are things I haven't said before, but I think it's on point. Please let me know, give me feedback. I want to learn from all of you in this room. From the conservative right, rolling back reproductive rights, restricting healthcare access, reinforcing patriarchal structures. The Geneva Consensus, launched in 2020, seeks to limit women's participation primarily to the family, a dangerous regression. This coalition has grown, but it's still a minority. It's 20% of the world's population. And then we have an attack also from the parts of the liberal left, if you identify with that, the erasure of women's identities by replacing language about women's rights with impersonal terminology. Women are referred to as chest feeders, pregnant people, people with cervixes, language that diminishes their identity. We do not want to refer to men as people with prostates. This alienation has created fear, silencing of women from speaking up, and to be labeled as anti-rights. The quest of validation of intersectionality needs to be balanced, and we need to move forward together, not against. There is a price to the cancel culture, and the liberal left is losing women and men to the right, and we must acknowledge that head on. It's not just in the United States, it's all around the world. Why in the anti-rights movements growing? Well, despite being a minority view, the movements are fueled by a combination of economic instability, political opportunism, deep-seated gender norms, and then we have to acknowledge what post-COVID world did. It created inequalities, job insecurity, social instability, and people are lonely. I've been traveling the world for probably about 9 months, a lot of it for fun, not for work, and it's been great. I've been connecting with people in their local communities, from our Uber drivers to taxi drivers to those selling groceries, people at the bar, people at the coffee shop. And one commonality is people light up when you actually take a moment to look into their eyes and just say, hey, how are you? Tell me about yourself. What do you do for fun? These are conversations we've forgotten, and we're feeling the impact of that in our everyday lives. So the backlash is growing, but we can counter it, especially with men and boys perceiving their shifting roles as a loss of privilege and responding through misogyny. I'm a mother of a 3-year-old boy. Well, he technically turns 3 tomorrow, but I can call him 3. I'm worried about his future because, he's not going to have much space to be a male ally, to be a feminist. There are very few options, and we got to think about our boys and men, but not at the price of our girls and women. At the same time, it's already been discussed here, but these rights organizations are getting billions. We're talking in millions in global health, and, we got to get to billions and trillions, right? That's the kind of money we need to counter it, because billionaires are funding, most of those billionaires are men, are funding a certain new type of vision for the world. And so we need funding to come in unrestricted ways to women's movements. Don, I agree with you. We gotta get them to women's movements that are working in local communities, especially in the global South. We've talked about restrictions on abortion and contraception. On the same page, We got to continue to push the legal and policy changes, but it begins in communities. These anti-right narratives are exploiting culture and religious sentiments. To my sisters in the global South, I'm conveying a message I've heard. Please challenge me on it if you don't agree. But in many of these countries where there are, women believing in this and men, the women's rights agenda is being pushed as a Western agenda rather than a fundamental human right. And we know that's not the case. So let's talk about how the voices from the global South are the real drivers of change, not just in the global South, but all around the world. And there's so much I want to say, and I'm going to fast forward because I'm mindful of time. We've had wins, but they're not secure. The real battles are being fought at the national and local level. We need to safeguard the process, and give resources to those fighting at the front line. A way forward is unity, not conformity. We don't need to agree on every detail. We need a shared commitment to advance the rights of women and girls. Our fights should never be against each other, especially in these times. Coalesce, don't fragment. The women's movement is diverse, and that is our strength. We don't need perfect agreements, but we need to commit to advancing a common agenda, a non-negotiable priority. We need to recognize the two-front attack. Patriarchy is the greatest weapon in division. We must reject the ways it comes up, whether it's identity politics, whether it's women being pit against women. We need to really work together. Grow the pie for all. I think there is this notion, especially when our ceiling is limited to 25% to 30%. I'm talking about health, but most of society will have a similar ceiling for women. It's not a zero-sum game. More power for women leads to stronger, prosperous societies, healthier communities, greater justice for all. In health, we call this the triple gender dividend. We must engage male allies, bring them along, especially those willing to be part of the solution. But let's not get held up by the men. They want to come along, great. If they don't, we'll still bring them along. Unconditional sisterhood. This one's particularly personal for me. We must support those who genuinely fight for women's rights. We must hold each other accountable while allowing space for learning and growth. Feminism, intersectionality, women's rights must be practiced, not just preached. At the same time, we must recognize that when women step up and lead courageously, they should not be torn down by those within our movements. We cannot afford to have internal conflicts that weaken our collective strength. Women who actively undermine or discredit other women's leadership must also be held accountable on their intentions. If we want to build a movement rooted in solidarity and respect, we must foster that culture. We have to be the role models. We can't be bystanders. Where leadership is celebrated, constructive criticism is encouraged, and personal growth is fostered. But personal grievances should not overshadow the bigger fight. It's time to get our house in order as women movements and become a united movement. Sustain the movement's leadership. A movement is only as strong as its leaders. We must remember to take care of our leaders. Think about the risks they're taking, legal, financial, security, life and death, not just for themselves. It's becoming dangerous for the women, especially at the front lines, who are providing contraception and abortion, family planning, even talking about a girl going to school. They are risking their life. We need to give resources and governments and donors and whoever's resourcing them for their protection, security, their mental health, their well-being. These are things that don't get funded in grants, so let's do it differently. Let's really support the leaders at our front line. The final thing I'll say is, I see this as a window of opportunity. I am someone that has always approached policy, and one terminology that stood out for my master's, and probably the only phrase for my public policy, is a window of opportunity. We can either look at the chaos as created right now as truly doomsday and the world is ending, or as we talk about a message of hope, we can see this as a window of opportunity, shaping a new global order that is, guess what? With women at the center, women as leaders, women unified, and also with the global South at the center. What is our version? What's our blueprint? And let's not just be visionary. Let's get our plans on paper. I've talked about Project 2025 in the United States. It obviously has impacts globally, but what's our blueprint? What's our counter push forward plan written down page by page, thousands of pages of how we're going to roll this out at the local level? And let's begin local. I'm not just talking national states, but really what's happening village by village, community by community, and how are we going to do this? I tell you, local, empower grassroots leadership. In the health sector, it's simple, empower community health workers, social workers, nurses, midwives. Doctors like me don't need extra power, I'm telling you, we're good. Nationally, let's reform the laws. We've heard a lot about this. I think this is where the real bit is. UN Women estimates 286 years before we close gender gaps and legal protections. Regionally, there's a lot of opportunity, support norm setting where there's culture and context similarities. Globally, I say, hey, let's it's okay if it's not happening in the UN right now, okay? It's all good. Globally, let's maintain our global relations, knowledge flow. Relationships should be nurtured beyond moments of crisis, fostering long-term trust, shared purpose, and mutual empowerment. And finally, make sure power and resources, direct funding, and power to frontline women's movements in the Global South to lead change on their own terms. Power is in the hands of women who are committed to women is our last hope for gender equality. Thank you.
Thank you so much, Roopa. I fully agree, diversity is strength, and voices from the Global South, women from the Global South, will be drivers of this global change that is so urgent and necessary. Unfortunately, we are running a little bit behind schedule, so I would ask you guys if you could please keep your interventions around 5 minutes. And next, we'll have Kemi from Feminista. She is the Chief Global Advocacy Officer there, to share your perspectives. Thank you.
I feel like I need to energize the room as well. Okay, since you all laughed, then that means we're good. All right. So it's an absolute pleasure to be here as I'm opening up my phone to get my speaking points. My name is Fadekemi Akinfaderin. Most people call me Kemi for short. And as Biruk rightly said, I lead the global advocacy work at Feminista. So today's conversation, I think it's one that is extremely close to my heart, but I think it's also something that I've been talking about for the past 2 weeks, as Dawn alluded to. And really want to appreciate the opportunity to be able to bring forth some things which I think both Dawn and Roopa have spoken a bit about. And so I 100% agree that we need to really look forward to center joy, to center collaboration in everything that we are doing right now, and not to give up hope. But I also want us to also realize and also focus on what we are actually dealing with in this moment in time, so that we can be strategic in terms of the actions that we need to take. So first of all, I want to kind of reflect a bit about the challenges that we're facing. And I really want to talk about how fundamental human rights are being under threat, and particularly the right to health, and particularly the right to sexual and reproductive health rights and justice. As we know, the right to health in SRHRJ is the cornerstone of human dignity. And it's essential for individuals, for communities, and for societies to thrive. But despite this, and despite this fact and this importance, we're actually seeing unprecedented challenges being thrown our way. The first I want to speak about is actually the assault on multilateralism and the assault on global health institutions as one of the core challenges that we're facing. As many of you already know, you can see the assault that the World Health Organization is currently facing, but not just only the World Health Organization, but also other UN agencies that are actually, some of them represented here. And this is coming in multiple facets, right? Through funding cuts, through pronouncements in executive board meetings, to withdrawal and actual political interference in what should be technical bodies that is driving the health and gender agenda. And we've also seen some of the frameworks in which we're working on being attacked. So frameworks, even, I mean, just this week as well, even though, yes, we did have a political declaration, but what is a political declaration without the recognition of sexual and reproductive health, rights, and justice? We've also seen attack on the UN Commission on Population and Development, which is happening in 2 weeks, and the increasing focus on ensuring that we don't have concrete agreements there to be able to prove or to make a case of its irrelevance when this was the agenda that gave us a human rights approach to population and development. It is not irrelevant. It is about everyday lived realities of women and the recognition that women have that bodily autonomy and the recognition that women and girls and gender diverse people have a right to health and a right to sexual and reproductive health. But we're also hearing even challenges or challenging to even the Sustainable Development Goals. And we heard that this week as well, in which that framework was called to question, a framework that we have all been working tirelessly on to be able to advance. So I think it's really important for us to think about this as an intentional, direct assault on multilateralism and the need for us to continue to support and to advance and to ensure that our multilateral system, yes, it does need some changes here and there, but the fundamental principle for which it was built on needs to remain. The second thing I wanted to talk about, and I think, colleagues have already talked about the anti-rights and anti-gender movement and how they seek to roll back, the hard-gained wins we've had, especially in the areas of human rights and in areas of gender equality and right to health. But I think we need to also recognize the fact that these movements are using the same frameworks that they seek to dismantle to advance their own agenda. For example, the Geneva Consensus, which I have to say here, is not an internationally recognized instrument. It is not legally binding. It's just basically a group of friends that came together and said, this is what we think. So quite honestly, it's irrelevant. But they are using it as a rallying tool. And they're using it based on the principles of multilateralism. Like that's, something that we need to think about. They do recognize the importance of working across regions and across movements to be able to have some sort of conversation and a guiding framework. I think, the other one that I want us to think about, of course, which Roopa and I think also Dawn mentioned, is Protego. I don't know how many of you have looked at the Women's Optimal Health Framework and how similar it is to the global strategy on women, children's, and adolescent health. It's literally picking up the exact framework and trying to come up with a counter element that doesn't necessarily align with evidence. And we know that. And so I think we need to, and we've also seen, of course, them using many of the human rights instruments as well, in terms of also advancing their agenda. So we need to actually look at how they're doing this and really counter that and really allow governments that we work with on a day-to-day basis, who might not necessarily know this agenda and who might not necessarily have a good understanding of the content, to understand that this is not based on science. And this is not based on fact, and it's not based on lived reality either, and needs to be thrown out. And the third, and I anticipated and asked myself, should I speak to this? But I think it's really important for us to recognize the significant cuts we're seeing in official ODA assistance, right? And especially what its impact is on gender equality and health. And we're seeing with, for example, the shutdown of USAID, and not to be so centered on the US, but I do think we need to recognize that the United States was the largest funder of global health. And how this is actually setting very worrying trends that we're seeing across the board, from other governments getting their gender equality program to reduction in overseas development assistance in other countries. And I'm not mentioning specifics, but I'm sure you all know the different countries I'm referring to. But what is that impact having in terms of on the ground? And I think it's been flagged over and over again, the impact in terms of access to health services, the impact in terms of the HIV pandemic, the impact in terms of our ability to end gender-based violence across the board. And so while this can feel a little bit removed to the everyday US citizen that's sitting down in New York or across the United States, we're seeing significant repercussions on the ground and in the day-to-day lives of people. And it's something that we need to make sure that we are paying attention to, but we need to actually respond to concretely. So where do we go from here? What exactly is it that we need to do? And I definitely align with every single strategy that both Roopa and Dawn had mentioned earlier, so I don't need to repeat it again and save on time. But I think that one of the things that we need to do, first of all, is that we must defend our multilateral institutions, especially those that are responsible for global health and gender equality. We must support the UN overall. We must support WHO. We do know, for example, just earlier this January, that certain organizations have been convening with member states and encouraging them to withdraw from the WHO, and particularly targeting member states from the global south, with an overfocus on member states from Africa and from the Swana region. So what are we doing to be able to work with civil society, to work with governments in those countries, to allow them to be able to unpack and to see the deceit in that? And I was very happy to hear that there was a particular African government that raised and challenged this notion and idea and said, if you ask us to withdraw from WHO, who's going to help us when the next pandemic breaks out? So it warmed my heart very much so to hear about that. I think second, we need to continue to advance our work. We need to communicate the impact of the work we do around gender equality and its impact also on the right to health. We need to promote evidence-based policies and programs that center and advance human rights and the right to health and gender equality. We need to continue to support civil society organizations, feminist movements that are on the front line, that are doing that work. They have a unique and specific responsibility and positioning to be able to do that work at national level. I think we need to hold ground at the global level, and there are several organizations that are set up to do that, but we need to move resources, as Roopa said, to the ground, to those that are working on the front line, so that they can do the good work with their governments and make sure that their governments understand the issues, understand what is at stake, so that that way they can defend. We can do all we want to do here with the missions, but if we don't have capitals on the same page and actually understanding what this grand scheme is about, then we're going to lose the battle nationally, regionally, and at the multilateral level. And the final thing that I want to say is that around the issue of funding, we need to continue to work across the lines with our champions that are working and from the global north to make sure that we stop the bleed. We cannot, I've heard so many times this week that this is the end to ODA as we know it. Okay, if you say so, but the reality is that we need to have funding continue to support this work that we're doing. And I think responsibility sits in both places. We need to make sure that our governments in the global north are not reversing on the commitments they've made. You cannot have a right to health, you cannot have gender equality without the right to development. And ODA is part of that right to development, and we need to be able to continue to push forward and advocate for that. But on the other side, for those of us that are from the global south, we need to hold our governments accountable. They have to put their money where their mouth is. They need to, we cannot have our health systems completely dependent on international and foreign aid. We have to make sure that public resources and finances are actually dedicated to achieving gender equality and the right to health. But I understand that there are broader systems at play, the macroeconomics, that we need to also still uproot, transform to make that happen, from the issues of debt, from the issues of the, what's it called, global economic and finance architecture. I recognize that, and we need to continue to advocate for that. So the issue of right to health, the issue of gender equality cannot be achieved if we're not engaging on the issues of economic justice and on the issues of climate justice. So we need to work on this interconnectedly and ensure that we're achieving that. And finally, I would just say the fact that, like, we need to basically continue this partnership. I don't think we can actually do this work, as Dawn had said, alone. No one single organization can advance on this work on its own. We need to make sure that we're continuing to build on the principles of multilateralism, the cross-movement engagement, the multi-stakeholder engagement, to make sure that we have different actors in the room that have their own specific niche and their specific entry points to be able to advance this in a unified way. We need to build bridges across different movements to be able to move this issue, because we all don't live single-issued lives. And we need to make sure that at the center of it is the issue of choice, the issue of bodily autonomy, but also the issue of movements at the center of it, advancing this work. And so that we can, quite honestly, make, I don't want to see 2030 come and we're in this position. Like, I really think that we have the opportunity now to not necessarily sit in the mess, but to rise above it and to be able to push forward, as Dawn said. So with that, thank you so much.
Thank you so much, Fadekemi. That was amazing. I think it's very important how you highlighted that the like-minded multilateralism is necessary. Focus on capacity building from both governments in the North and the South. And we have one more panelist today. Payal, please. The legal and advocacy representative from Physicians for Human Rights. Thank you.
Your Excellency, for being here today, and for my fantastic co-panelists for the rich discussion. I have to say I'm pausing after so much insight and reflection, and I think a lot of hope. I will say I maybe am coming with a little bit of a deeper dive into how we're seeing the current backlash playing out. But one reflection I take from listening to all of you, and hopefully I think will reflect in some of my remarks, is that there is a denial of shared humanity that's happening right now. What we're seeing globally is this idea that our borders and our militaries can protect us within these individual kind of arbitrary lines, that there isn't a need for multilateralism. There isn't a need for us to think about our health as a species, as humans, that we can foment violence, including gender-based violence, in one pocket of the world and not have it have impacts on other parts of the world. And there's this idea that borders and militaries will save us, when actually the dangerous conditions that we're creating in the global South, but all over the world, including here in the US, are going to cascade across borders. And I keep hearing about when the next pandemic comes, And, you know, at my organization, Physicians for Human Rights, where we're speaking to physicians and health workers daily about what they're seeing, the next pandemic is here, it's on its way, you know, and it's really not far off. And actually, even the pandemics that we have corrected, things like TB, you know, we are creating the situations right now for drug-resistant TB, for ongoing, for these pandemics to resurge and quickly. So maybe just to say, my co-panelists have shared many critical insights from the overall progress since Beijing. What we've seen since that moment includes significant positive global shifts. For example, over 50 countries have liberalized their abortion laws since 1994. But it also includes profound global backlash, manifested in many countries, but very visibly here in the US, where the past 3 years have brought the overturning of Roe v. Wade and increasing backlash to gender equality. Currently, in addition to this attack on human rights and gender equality, we are also seeing a full-scale dismantling of the global health system, catalyzed, but certainly compounded by other governments, catalyzed by the US government's funding cuts, but compounded by many other governments now stepping back. The intersection of these crises has created dangerous conditions that threaten our progress since Beijing by simultaneously disempowering women, girls, and individuals of marginalized gender identity, while also making healthcare increasingly less accessible or inaccessible altogether. Beyond this, in parts of the world that have already been facing other crises, including conflict and mass displacement, the situation is ripe for catastrophe. My organization, Physicians for Human Rights, has been working at the intersection of science, medicine, and the law to advocate for the right to health and dignity for individuals in situations of conflict and crisis, with a focus on attacks on health, sexual violence and conflict, reproductive justice, and freedom from torture. And I think picking up where Kemi left off, really looking at a concrete situation, I want to zoom in on a country where PHR works really closely, where over the past few months, we've seen these dangerous conditions really coming to a head. PHR has worked for well over a decade in Eastern Democratic Republic of the Congo, where we are currently seeing what we call a quadruple crisis of conflict and conflict-driven sexual gender-based violence, mass displacement, unchecked spread of infectious disease, and the US government funding freezes. Since 2023, 7 million people have been displaced by armed groups in Eastern DRC, especially in North and South Kivu. And there's been a surge of cases in sexual violence with 123,000 rapes reported. Research undertaken by PHR confirms that health workers have documented a massive influx of cases there in recent months. This year, the security situation in Eastern DRC has deteriorated even more due to the aggressive expansion of the M23 militia. In late January, M23 captured Goma, the capital of North Kivu, leading to over 3,000 deaths within days. By mid-February, the militia advanced into Bukavu and South Kivu. In the last 2 weeks of February alone, more than 895 cases of rape were reported to humanitarian actors in 2 weeks. This averages to more than 60 rapes per day. The occupation has resulted in widespread looting of hospitals, civilian casualties, and mass displacement, with M23 forcibly evacuating IDP camps and thousands fleeing to neighboring countries, further exacerbating the spread of infectious disease and cutting off communities from care. Last week, or 2 weeks ago now, M23 raided 2 hospitals in North Kivu, including a center that specializes in treating survivors of sexual violence. Rebels reportedly abducted 130 patients with gunshot wounds on the suspicion that these patients were Congolese army soldiers or members of the pro-government Wazalendo militia, yet another major violation of international humanitarian law. Compounding this crisis, the US government funding freeze imposed in January has impacted 70% of all humanitarian aid to DRC. And now hospitals are unable to provide many critical services, including services for SGBV survivors, as well as the ability to track or respond to infectious disease such as Mpox. For us at PHR, these orders caused an immediate pause in programming to document sexual violence and support child survivors in the Democratic Republic of the Congo. It's important to note that the impacts of these funding freezes were specifically compounded by the Trump administration's explicit refusal to consider sexual and reproductive health care, such as abortion care and contraception, as life-saving humanitarian assistance that would be subject to the waivers. Together, this quadruple crisis has both fomented conditions of grave health risks, including of gender-based violence and sexual and reproductive health harm, while also fundamentally undermining the system for delivery of essential sexual and reproductive health care, and specifically post-rape care. As Sophia Kaltorp, Chief of Humanitarian Action at UN Women, stated in her remarks on the situation of DRC, as the clashes unfold in a country that has endured prolonged instability, women and girls are bearing the brunt of both direct and indirect consequences, with their rights, safety, and dignity increasingly under threat. There is a critical need for this rethinking of the global system, for international action to provide a coordinated response to the health risks triggered by this quadruple crisis. Many governments have responded to this moment instead by turning inwards, by focusing on defense and military spending in an attempt to provide security. Yet it is a grave mistake to believe that allowing the rollbacks in rights and health that are occurring in countries like DRC will not have impacts across borders. These crises create the risk of spread of diseases such as Mpox and, as I noted earlier, drug-resistant TB. I just came back from Kenya where we were visiting a hospital that essentially let go its entire staff that was monitoring TB, including drug-resistant TB. I mean, these are really going to be quick consequences that we will see if there is not action. Further, the impunity and failure to respond to the uptick in gender-based violence in countries like DRC is also perpetuating the normalization of such violence, which itself is recognized as a global public health pandemic by the WHO. And that's something I really want us to sit with when we think about pandemics. So ultimately, what we're seeing is a human rights crisis intersecting with the public health crisis, with these devastating impacts on gender and other forms of equality, and an urgent need for us to be able to find ways to tell the stories of the human impacts, to be able to talk about the transnational and impacts of not acting. For us to show in some ways why multilateral institutions need to exist. The reason they need to exist is because our problems cannot be contained within borders. We have to find the ways for collaboration. So maybe just to say that's, I think, there's been a lot of recommendations here on how we do that. So I won't repeat that, but I think that is an essential part of the work ahead of us to talk about the ways in which borders don't contain these problems and that we need to tackle these as humans together. I wanted to note two other threats on gender equality and health that we've been following at PHR. The first, and I think we see this here in the US, but frankly has been happening in many other countries for a long time as well, is the attempt to convert the health system into a tool of law enforcement, including through the criminalization of abortion and policies opening the door to increased immigration enforcement in health facilities. This has been an ongoing issue, but really coming to a head here in the US. And this is causing significant impact on care that women and girls particularly need, but also intersectional, like barriers to populations that face intersectional discrimination, including, for example, immigrant girls and women. We're also seeing globally an increased attack on health in conflict and persistent impunity for these attacks. In 2023, the Safeguarding Health in Conflict Coalition documented 2,562 incidents of violence against or obstruction of healthcare facilities in conflict across 30 countries or regions within countries or territories, which is over 500 more than in 2022, which is a 25% increase. And preliminary numbers show that this number has increased even further in 2024. And this is something we haven't discussed here today. We're also seeing a deliberate attack on the healthcare system and on healthcare workers. And that's something that needs to be addressed. And what we're seeing is impunity for these attacks, and also the undermining of institutions like the International Criminal Court that are designed to ensure accountability for these kinds of violations. So this is another area where I think we need to think beyond just the global health funding. We also need to be thinking about accountability bodies. We need to be thinking about the attacks that are happening there and how they are engendering the kind of violence that we are trying to combat. And then finally, I'll end, since I know we've worked hard to keep the hope in this conversation, and it's hard in these moments. But what's giving us hope here at PHR and with our partners is really is the interest in solidarity across borders. Every conversation we have with health workers around the world is them wanting to stand up together, wanting to find ways to partner, wanting ways to raise the stories of the human impacts of these different shifts and why it is we need to come together collectively. We're also working on elevating the brave voices of those health workers and clinicians, community activists that want to be speaking out, that, for example, in the face of these funding cuts by the US government are willing to be vocal, even at potential risk to their own sustainability financially. We're also fighting over compliance. What we're seeing is a lot of fear right now. And that fear is something that sometimes leads to health workers, or especially hospitals, pushing forward very conservative policies, right? So for example, I heard somebody say here in New York that as the Trump administration came into power, their hospital administrators told them the only advice they gave clinicians was when the immigration officials come in, don't stand between them and the patient. And that was it, right? We have to push back at that. There are more rights, constitutional rights. There are other rights that are there. And so we've been working on creating tools and trainings to be able to give clinicians, health workers, hospital administrators, the frontline, the person working at the security desk in the hospital, the tools they need to be able to ask, hey, what kind of warrant is that? Do you have a judicial warrant, or is this not actually a warrant that lets you go talk to my patients? So, really providing those tools to push back and to really allow clinicians to do what they need to do to hold up their medical ethics and provide care. And then the last thing I'll say is we just had a convening of our student chapters of our organizations and medical students from across the country. And I will say this next generation is the other space that really gives me hope. I know, I think that the discussion at CSW with youth actors has been really inspiring. And I think this is another area where we really hope to be able to elevate, the youth voice and push back or push forward into this new world we're reimagining. Thank you.
Thank you, Payal, for your very clear focus. We'll now be moving into a Q&A portion. So could I please invite anyone who has a question? I can come over with the microphone. Yes.
Andrea Bassel. I serve as the founder for an institution called the Wawaba Institute, which is a womanist feminist theological institute. My question is around faith. I've heard a lot of things being said, but I don't believe that we're addressing the role of faith in the movement for global health and for the rights of women, gender equality. Most of these countries that I work in, faith behaves as a sanction for most of the people's lives. It is foundational to belief systems, to actions, to how matters are addressed, how decisions are made, policies, etc. And yet, I feel like the funding for faith organizations that are feminists and faith, justice and faith around women and girls and gender is severely dismissed. I mentioned I'm also a bishop in the Lord's Church, and I absolutely work for sexual and reproductive health, LGBT rights, etc. And I feel like when I stand up, I am a unicorn. Yes, there are pastors, bishops, churches, organizations that are fighting for LGBT rights, gender equity, etc. But we need funding and we need to partner with other organizations, because we can go in and say all we need to say, and then the people go to church on Sunday. And a lot of that is dismissed, or they go to mosque, or they go to temple, and a lot of that is dismissed. We are working to provide informed theological education that dismantles a lot of the misinformation and disinformation about faith, and we need partners. Thank you.
Thank you. Would anybody like to respond to this? Please don't.
I commend you. One of the deliberate strategies used by UNFPA is working directly with faith-based organization, faith leaders, and it's couched in our wider strategy of culture, because we believe it is impossible to work on issues. Let me back up and say, UNFPA has the sexiest mandate in the UN system, because we talk about sex, right? So we don't have a choice but to talk about sex. It's core to our mandate. But within that context, we're touching people's lives in the most intimate ways and spaces. And so we coach all of our work with faith-based organizations and faith leaders in the context of our wider culture space. It provides us then to address issues like youth engagement. It provides us the opportunity to look at the way that, the holy books are interpreted. Because a part of the challenge that we have is not so much what the Holy Quran or the Holy Bible says, it's the interpretation of those. So we do work in supporting organizations to better understand and communities to better understand how these holy texts are written and to understand the interpretations around them. There is an engagement that we do with faith leaders and faith organizations around advocacy. As you've rightly said, when all is said and done, if my pastor or my priest or my imam tells me otherwise, that's the direction I'm going in. So we spend a lot of time in terms of advocating for issues that are relevant to the work of the organization, recognizing that our faith leaders cannot go to the full extent that we may want them to. So, for example, they will never promote the use of condoms. And if that's the case, what are the other areas that we can work with them on, right? So we look for partners depending on the extent to which their mandates allow them to work, and we engage with them at that level. So I think, the work that you're doing, strong commendation to you for that. Within the UN system, there are organizations who are doing that as well. And I'm sure my panelists can speak to that. I'm happy to speak to you after to share my information, because I can put you in touch with different parts of because we have offices in over 150 countries. So wherever you are, I can tell you that we have a UNFPA office there who is likely doing the kind of work that you're doing as well. So kudos to you.
Thank you. Thank you, Don. Mhm.
I'll make mine very, very brief, but I'm extremely happy to meet you and to see you here and to hear your voice and the work that you are doing. As we say, you are doing the Lord's work. And so I just want to recognize you on that and to say that you are absolutely right. And there are a couple of organizations that are doing this work and that we've been partnering with. For example, the networks for Catholics for the Right to Decide, for example, is, an amazing network. And we do a lot of work as Force Feminista with them in the Latin America and Caribbean region. But there's also an alliance with Faith to Action or Faith in Action. I can't remember what the middle word is, but I would be happy in the ACT Alliance. I'd be happy if you are not connected to them already to be able to make those connections as well. But I do want to say that I'm so overjoyed because I also am seeing now also faith leaders really taking up space and providing us with alternative messaging, like alternative perspectives, so that we're not just consuming that one that constantly comes that is undermining gender equality, that's promoting fear and hate in all its forms. And even just, I don't know how many of you in terms of social media, I'm seeing more faith leaders actually take to these platforms and really educating the public of what the books say and what they don't say, and challenging some of those misinformation and disinformation that's being put out there. So I just want to echo Dawn as well in terms of saying thank you for doing the Lord's work. And I'll end it there.
So I think we only have time for one more comment. So Your Excellency, please, did you have one?
Good afternoon, and I really wanted to say something. It's just a remark to appreciate the panel and what you've said today, but also to say to the Special Rapporteur, thank you for inviting me. And every time you do these kind of, create these spaces, I'm always amazed, whether it's around nutrition and the right to health, or this particular one, I always learn something. And as a member state, walk away very encouraged. I mean, the fact that you brought to the center of this discussion how to defend multilateralism, that Payal, when you started there to say borders cannot contain these problems. I mean, that's why multilateralism exists, for us to come together collectively and see how we address this problem. And you brought it, Femi, this attack on multilateralism. And then connecting that to what Don just said about at the beginning, pushing forward. And I think part of that pushing forward, in the space that I am when we are negotiating some of these instruments, I wanted to say, let's push forward in the upcoming big meetings, the financing for development. How do you make sure that we push forward this particular issue, financing, in the FFD4, where we'll be talking? And for my country, which is presiding over G20, we are definitely, again, Dr. T, you see how you bring this agenda. It's there, and making sure that it's again pushed forward in the G20 space. And then lastly, the other issue that I feel strongly about is in the conflict-affected areas. So again, I couldn't appreciate more to say in this space again, the focus on conflict-affected areas came up. DRC, South Sudan, Sudan. We now know what happened in the last 24 hours in Gaza. And you have been
I mean, you deal with this all the time. So I'm very happy that the women peace and security, but also the health issues too. You've raised those issues, and we always need to connect those dots. And I'm grateful to all of you. I think when we are in the halls of the UN, I always say we can't do all of this without we the people, and civil society truly represents we the people. So again, being part of the system and making sure that we can be able to take some of these forward through the processes that we have at the UN. So thank you very much. And Susan.
So in the interest of time, could I please ask all of the panelists to maybe share one word that we could carry with us after this session wraps up?
Hope.
Push forward.
I know it's okay. Hope, push forward.
Shared humanity, I'll take two.
Thank you. Yes. Thank you all to this panel of experts. Those in the audience and online, our deepest gratitude for joining us in today's side event. And I would like to reinforce the call for gender equality and human rights as being central to health and justice. So we will have a brief 30-minute break. There's refreshments in the back, and then we'll reconvene at 2 p.m. for the second session on advancing transgender health rights and gender equality. Thank you. Thank you.
People online. Good morning, everyone. Afternoon. It's afternoon. Good afternoon. Please take your seats. Hey, beloveds. Please take your seats. We're about to start with our session. Oh, no, we'll do it afterwards. Is that fine? Yeah, yeah. Unfortunately, now we are. Oh, is that what you're doing? Okay. All right. We're
Okay. Yes. Okay. It's green. It's green. Okay. I want to welcome our keynote speaker, Dr. Kellen Baker, who's the Executive Director of the Institute for Health Research and Policy at Whitman Walker, which fosters healthier communities and advances good health for all through person-centered research. Dr. Baker holds appointments as affiliate faculty in the Department of Health Policy and Management at the George Washington University and the Johns Hopkins School of Public Health, where he received the Golden Apple Award for Excellence in Teaching Public Health Studies. Welcome to you, Dr. Baker, and thank you so much for making the time to have this critical conversation with us.
Thank you so much, Sarah and Dr. T and esteemed panelists. I'm very honored to be with you today. It's a real pleasure to be with you today. And for many years, it has also been a pleasure when we come together to describe and celebrate the groundbreaking ways in which coalitions of trans advocates and allies around the world have been achieving success after success in removing restrictions on transgender lives and advancing trans rights in countries around the world, such as Argentina, Denmark, India, Uruguay, and many others. Even as we've celebrated wins, though, the realization of safety, dignity, and health-related rights in practice has continued to be a challenge for trans people globally. And now, it is with deep concern that we have come together to reflect that trans people are under major attack in countries around the world, including but not limited to Russia, the UK, Ghana, and right here in the United States. I know this on a deeply personal level. I transitioned in Russia 20 years ago this year. Don't I look great for being a 20-year-old? Thank you, thank you. In 2008, I co-founded an organization called FTM Phoenix that did things like helping translate the World Professional Association for Transgender Health Standards of Care into Russian. In 2014, we organized a conference in Moscow that brought together trans community members, healthcare providers, and government representatives from 8 different countries. But as of 2023, Russia has passed a law prohibiting trans people from accessing medical care, getting married, adopting children, and having identity documents that reflect who they truly are. And now, here in the United States, that same medical care that was so integral to my survival 20 years ago and today, that I received in Russia 20 years ago is now illegal in more than half of US states. Some of the common themes of attacks on trans people worldwide include outright bans on the provision of essential medical care, prohibition of coverage of this care by national health systems and private health insurance carriers alike, criminalization of patients and families for seeking care or possessing essential medications, criminalization and prosecution, including right here in the United States, where a number of healthcare providers have already been criminally charged for providing care to transgender people. There are restrictions of healthcare to poorly defined and coercive research settings, prohibition of identity document changes for transgender people. And indeed, many of us here are aware that it may actually be dangerous for transgender people to leave this country and for transgender people seeking to come and visit this country. Redefinition of the legal category of sex to exclude transgender people, including the weaponization of international gender equity measures. And most recently, right here in the US and in other countries, legislation has been introduced that would make my entire existence, the fact of being transgender itself, a crime. These attacks aren't coming out of nowhere. They are deeply enmeshed, both in the United States context and worldwide, with attacks on reproductive health care and abortion, with HIV criminalization, the ways that simply living with HIV or being a person in community who is seeking to prevent HIV could be considered a crime. Resurgence of state-sponsored racism and anti-immigrant sentiment, and the renewed march of imperialism across the globe. Why is this happening? There are a lot of different reasons why we are seeing transgender people and so many other communities at the direct center of so many attacks. There are international networks that are spreading disinformation and misinformation, many of them based here in the United States and in the UK. They are coordinated, they are making use of fringe, social, and mainstream media alike to spread lies about who transgender people, our families, and our communities are. There is the use of trans people as a wedge issue, as if our lives, as if our entire existence is nothing but a political issue, being pushed under the guise of gender ideology to divide and weaken national and international feminist coalitions. And there are efforts afoot to undo decades of sex non-discrimination protections by using trans people to open the door to the undermining of rights for women and for so many other communities. So what do we know? We know a lot. International and national expert medical authorities support essential healthcare like the type that has made it possible for me to be here standing before you today. We also know that trans people continue to be at risk of serious harms in countries around the world, including violence, rejection, and legal sanctions just for being who we are. But we also know that trans people want the same things any person wants. We want the ability to live our own lives and to thrive as individuals and as members of families and communities. We know there is nothing wrong with trans people. There's nothing wrong with being transgender. And we also know that trans people aren't just survivors. We are world changers. We are leaders. We are integral parts of global movements for women's rights, for gender equity, for racial and economic justice, and for healthcare for all. We here today stand on the shoulders of giants. Makes me a little verklempt, actually. Julia, you can translate that, verklempt. To talk about the ways in which we stand on the shoulders of giants here in this room, across the United States and across the world. And we are led by some of the world's most brilliant strategists and leaders, folks like Julia, Marcela, and Chiara. It is truly a pleasure and an honor to turn this conversation over to them and to Dr. T. Thank you.
I'm going to remain seated. Can everyone see me? Is that okay? All right. And thank you very much for your remarks. It's really important for us to set the context and the scene for our conversation. And I think it's important to also acknowledge the session that happened before this one, that there is a lot that people have been commenting during the break, and that there may be still some comments that people want to also contribute from that session into this one. I think we are intentional and trying to be practical in how we live intersectionality, even in how we do the work that we do. And we hope that today you have felt a little bit of that positive impact of what it means to have people who are impacted by the issues we discuss on the table speaking for themselves. I don't believe that people need empowerment or that people are not heard. It's that the system chooses who it sees as human first and foremost, and therefore it places a value in what they have to say, and therefore who gets to be heard and not heard, who gets to remain invisible. And part of the conversation today is to demand the rights of all people, but particularly transgender people, to advance. And I think the word advance in our poster is very deliberate, that we are not just standing here accepting the status quo. We know the challenges, they have been there. They are now, however, impacting other sectors of communities, of societies in a way that they thought the assaults were reserved for gay, lesbian, trans people, those who seek abortions, sex workers. And I think part of the crisis that we see and the hysteria that we see is that a lot of people who thought were excluded from these kinds of assaults of the global gag are now thrust in the middle of what that means. And I think it is with humility and grace that we are able to share some of the ways in which we have advocated, some of the ways that we have remained strong in spite of those attacks that have been there and have been sustained for decades now. And I want to locate our discussion also fully in terms of human rights, that in fact states have a legally binding obligations in terms of the right to health. It's not a special favor or a special ask in terms of advancing, protecting, fulfilling, and respecting the rights of transgender persons. And as the Special Rapporteur on the Right to Health, I've dedicated my tenure and every single report of mine to using anti-coloniality and anti-racist analysis, but also proposing in very intentional ways, intersectional and very forward-looking recommendations in how we can impact the world. And we know that controlling sexuality has its origins in patriarchy, and I call in my reports patriarchal oppression, and I name it as a form of violence that is both interpersonal but also very replicated in systems that all of you on this panel try to navigate every single day. And thank you very much for coming to retell often some of your lived experiences and to go down that path again with us today. And it's a privilege for us to have you to be able to share with us as well. And so I want to start this particular panel discussion by introducing to you Julia, who is, I'm going to get Julia's bio right now. Julia is a pioneering trans activist and advocate in Europe, currently serving as a director of programs at ILGA. They were previously the executive director of Transgender Europe, playing a key role in its growth and advancement of trans rights across the region. With extensive experience in advocacy, she has also shaped global conversations on trans issues and LGBTQI rights. She's a member of the steering committee of the International Trans Fund, a board member of AWID, and a signatory of the Yogyakarta Principles +10, and she holds a PhD in mathematics and lives between Berlin and Geneva with her parent and child. And so over to you, Julia, for your opening remarks. And I think without prompting you too much, just what lessons have you learned from past victories that you have in terms of advocacy that can inform some of the future strategies?
Thank you, Dr. T, and thank you for all of you to come here today and for the invitation to let me speak here today. So what lessons have we learned from past victories on trans rights advocacy? And before I go into describing what we are, in which situation we are now, you've heard a lot from Kellen already. I want to recognize the large changes that have occurred in a lot of societies in the world when it comes to trans rights. I mean, similar to Kellen, my coming out is more than 20 years ago. And I think from a trans person's point of view, 20 years ago was a different world when it comes to trans issues. I'm German, so my coming out was as well in a global north country, not unlike the US, but still, 20 years ago, when I said to a person, I was assigned male at birth, which you might have guessed, but when I said to a person I was a trans person, most people would not have even known what that meant. And those of you who have ever read Butler, who speaks about an intelligible gender, like something that is so beyond the norm, that is unthinkable. That's, I think, what grasps the lives of trans people in society. It's not only that we were, exposed to violence and discrimination in all aspects of our lives. It was as well that it was just like vanishing. We were almost not there. And I think looking back, that was one of the most striking experiences. The experience of from one day to the next of being not represented in society in any way, shape or form. There were no trans persons in politics, no trans persons in the movies, no trans persons anywhere visible. And I think saying that, because I think it's as well important to understand what makes this point in history 20 years later so significant, and why some of the veg issues, or some of the aspects of trans being a veg issue, why this is working. And I think one of the reasons why this is working is because there has been such a tremendous transformation in society, which has been facilitated through the changes of law. And I think I'll come to that maybe in this intervention, maybe in the next one. But I think it's important to recognize that, one, there's been changes in society, but I mean, the facilitation of those changes has not necessarily been brought through the change of public opinion, but through the changes of law that then triggered public opinion changes possibly. And the thing with changes in law, I believe, is they're like, and it's not that they're easy to achieve. Actually, they're achievable relatively. It's quite difficult to achieve those changes in law. But in comparison to changing perception in society, changes in law are actually quite easy to achieve. Because I think changes in, to fundamentally change society in their perception of gender. And I think that is what would be required to recognize transgender people in our full experience. That is much, much more difficult. So what we have been striving on as a trans community over the last 25 years is significant changes in the law. Just to give you one small example on how that transpires in Europe. So when Transgender Europe, there's a European umbrella organization for trans organizations, started advocacy work in Europe. That was in around like 2006 or 7. One of our key target advocacy goals was to remove the sterilization requirement among European countries when persons wanted to change their name and gender. When we started, we had like 27 countries in Europe. In the Council of Europe, which has 43 member states, 27 countries had a requirement like that, requiring a trans person to be sterile. Only 10 years later, that number was not even half of that. So, okay. So just to give you an idea of the drastic legal changes that we've been achieving, and that's as well true to some extent to other regions in the world, to a less extent than in Europe, but to some degree as well. So, but coming back to what can we learn from this, and what can we learn from this in this particular moment? I think what we can learn from this, or maybe let me, one quick interlude. What did it take in order to get these achievements? And I think the first step in these achievements was to basically convince the LGBT community at the time to become trans inclusive. Because the first, let's say the first decade of my life and probably our life and a lot of people, a lot of trans activists' lives was actually not to work, on social change. It was to battle trans exclusion in LGBT settings. Because already at the time, 20 years ago. I mean, there were organizations called themselves LGBT, but I don't think that at that time, the T was actually mainstreamed in the work of LGBT organizations. And I think the first step in achieving legal change was to convince the LGBT movement that they actually needed to put flesh to that aspiration of working on trans issues and mainstream trans issues within their own movement. And that has happened. And of course, then with the whole machinery of the LGBTI movement at hand, trans issues made landslide wins. What can we learn from that? We can learn from that the LGBT movement has significantly discriminated trans persons. And if you think of that, there's like close proximity of the experience of trans people and the experience of gay and lesbian persons. Nevertheless, LGBT communities discriminated strongly against trans, and we had to overcome this as a community. And what we can learn from this today, and this brings me to my conclusion in this part, is what we can learn from this today. This is one of the reasons why I believe the current surge of anti-trans rights is actually working. Because if you think of it, even a community that has so close proximity in terms of their experience in society as being discriminated on grounds of their sexual orientation, discriminated against trans persons, and we had to fight in that community for recognition. That suggests that the fight in the society at large is much harder. And in a certain way, with all the achievements that we had in legally speaking, I don't think we've managed to take the societies with us. And this is the moment where we pay for it, because the anti-trans argument resonates with too many people in mainstream society. And that's why it's used as a wedge issue. It's used as a wedge issue in feminist circle, in women's circle, but it's as well used, in particular in this country, to challenge public education and go for homeschooling. And it works because the critical mass of trans supportive people is too small. And as a community, as the trans community, we're kind of a very small community, and in addition to that, face a problem that many of our community members actually want to be invisible, because most of us will just want to go on with their lives and not being visible as trans persons every single day, because we pay dearly and deeply if we are visible in our societies to this day. And this is why kind of this wedge issue approach is so functional at this point in time. And I think that's what we can learn from our victories over the last 20 years.
Thank you very much, Julia, for that intervention. And I would like now to move over to Marcela. And just to say that Marcela will be speaking in Spanish, and thank you for translating for us, Isabel. And Marcela is an Argentinian human rights activist and a leading advocate for trans rights in Latin America and the Caribbean. Since 2006, she has served as a regional coordinator of Red La Trans and is the president of ATA. She founded Casa Trans, the first trans community center in Latin America, and she has played a key role in advancing legal protections for trans people, including the gender identity law in Argentina. Recognized as Woman of the Year, yes, by the Argentinian Congress in 2009. She has also received the Clarence H. Award from the Pan American Health Association for her advocacy. And thank you very much. And over to you, Marcela. Merci. Muchas gracias.
Buenas tardes a todos, todas y todes. Disculpen que no hablo inglés. Contarles que Argentina en este momento está viviendo un gobierno como el de Estados Unidos, un gobierno fascista, un gobierno antiderecho, un gobierno que viene a destruir nuestros logros y nuestros derechos, porque son nuestros derechos todo lo que logramos, que en nuestra Latinoamérica, en donde tenemos democracias débiles.
Hi, everybody. Thank you so much for joining us today. And I apologize for not speaking English. I'm I want to share with you that Argentina has been going on through a fascist and a far-right government that is taking away the victories that we achieved during these years and destroying and taking away the rights that are ours. And this is of great impact for the entire region of Latin America.
La población trans en Argentina tenemos dentro de nuestra plataforma política el transfeminismo. Empezamos primero a desconstruirnos internamente, descolonizarnos, sacarnos un montón de cosas que no nos dejaba poder vivir como tiene que vivir una persona trans en Latinoamérica. Estábamos colonizadas.
For us in the trans movement in Argentina, it has been very important to go through a process of decolonization and deconstruction ourselves to get to live as like a trans people is supposed to live, like freely, to freely live.
Siempre mirábamos al norte, mirábamos a Estados Unidos, a Europa, como los países que tienen todos. Y en realidad la población trans logró la mejor ley del mundo, que es la ley de identidad de género de Argentina. Y también la tenemos en Bolivia, la tenemos en Uruguay, la tenemos en Costa Rica, en algunos países tenemos resoluciones, pero pudimos hacer una ley de identidad de género latinoamericana, con una construcción de las mujeres trans en Latinoamérica, que nos construimos desde nuestra niñez y adolescencia.
Even when during many years we were looking up to the north, to the US and to Europe to find some examples for us, we finally realized that our own struggle is like very good itself, and the way that we achieve the best gender identity law, like the Argentinian identity law is one of the best in the world. And also it has influenced other countries to adopt similar legislation as Bolivia, and in other places we have had cases supporting. And this was achieved only because of trans women, Argentinian trans women, who were putting their identity and their struggles into achieving this.
Nosotras estamos sufriendo lo mismo que sufren en Estados Unidos, el tema de la ideología de género, el tema de eliminar la construcción y los derechos de los niños trans y las niñas trans.
We are in Argentina experiencing the same as in the US, heart attack against trans communities with this gender ideology phrase, and also like attacks against the identity of trans children and teens.
Las personas trans no nacemos a los 18 años. Yo tuve niñez y no supe lo que fue mi niñez. Viví en una niñez machista y patriarcal.
Transgender people are not born when they are 18 years old. And I couldn't have a childhood that I enjoyed because it was marked by patriarchy and misogyny.
En Latinoamérica existe la muerte social. Y yo siempre digo que esa muerte social que tenemos las personas trans se transforma en pena de muerte.
In Argentina, in Latin America, we have social kill, like social death, and that's what we experience when you leave your identity as a trans person.
La expectativa de vida de una persona trans en Latinoamérica es de 35 años.
The life expectancy of a person in Latin America is 30 years.
El 99% ejerce el trabajo sexual o la prostitución.
99% of our community work in sex work or prostitution.
Los servicios de salud que logramos en Latinoamérica, la RELAC Trans,
the health services that we achieve as Red Flag Trans,
todos están en riesgo de cierres.
all of them are under risk right now.
Nosotras decimos que la democracia latinoamericana tiene una deuda con las personas trans.
The Latin American democracy is in debt with trans people.
No conocemos la democracia.
We don't know about democracy.
No queremos ser las olvidadas de la democracia.
We don't want to live out of the achievements.
La democracia la construimos entre todas y todes.
Democracy is built with all of our efforts.
Y en Latinoamérica no se puede hablar de salud sexual y reproductiva.
And in Latin America, we cannot talk about sexual and reproductive health.
Las personas trans no estamos dentro de los espacios de aborto legal y gratuito.
Trans people is not included in access to abortion.
No tenemos profesionales capacitados para acompañar la construcción de una persona trans.
We don't have enough public services and enough healthcare for trans people.
En Latinoamérica todo es ilegal.
In Latin America, everything is illegal.
Los medicamentos,
Medicine,
las cirugías,
surgery,
la automedicación,
self-medication.
y sabemos que los aceites que nos ponemos en el cuerpo para feminizarnos,
And we know the oils we use to feminize our bodies
que nos llevan a la muerte.
are a cause of risk, a cause of death.
Lo que estamos haciendo en Latinoamérica en este momento es resistir,
What we are doing in Latin America is to resist,
denunciar a los gobiernos,
go to courts against the states,
formar a compañeros trans,
grow capacitation for younger trans people,
para poder tener discusiones políticas en sus espacios de donde viven.
to be able to have political talks in the places where they come from.
Queremos avanzar en el tema de la ley integral trans.
We want to advance in an integral law for trans people.
Es el reconocimiento de todas las mujeres y hombres trans adultos mayores
In order to achieve all the acknowledgement of all trans and women and men,
que las democracias de nuestra región no le dieron la posibilidad de poder formarse, trabajar, estudiar, jubilarse,
because before our democracies denied them the right to grow, to study, to have a retirement in social services.
Latinoamérica sigue siendo una región de dictaduras militares
America is still a region of military dictatorships,
guerrillas
guerrillas,
y dictaduras democráticas.
Democratic dictatorships.
Hay países que tienen gobiernos de izquierda y parecen de derecha.
There are countries with left-wing governments, but they look like far right.
Hay gobiernos progresistas en la región que no cumplen los derechos universales.
There are progressive governments that are not fulfilling the demands and accomplishing what they promised.
Nos encontramos como país, como Chile, ahí está una compañera mía chilena,
Places like Chile,
donde la ley de identidad de género sale en un gobierno de derecha.
where the gender identity law is coming up in a far wing government.
Creo que tenemos que tener mucho cuidado
We need to be very careful
cuando votamos.
when we vote.
La solución no es la represión.
The solution is not repression.
La pobreza no se combate con más represión ni exclusión social.
Poverty is not going to be solved with more repression and social exclusion.
El punto principal en la población trans es la pobreza.
And the main issue for trans
La
population.
pobreza es transversal a todo. Mujeres negras, mujeres afro, mujeres con discapacidad, mujeres con VIH.
Women, women with disability, women with HIV. All of them are like marked by poverty.
Creo que lo mejor que se puede hacer es conocernos, que todos nos conozcan y que sepan que nuestra realidad es a lo mejor otra realidad que ustedes conocen.
I think the best we can do is to get to know each other and spread the word about our situation.
Nosotras somos abuelas, madres, tías, hermanas.
We are grandmothers, mothers, aunts, sisters.
Muchas de nosotras no podemos reconocer a nuestros hijos.
And many of us are not allowed to have a legal recognition of our families, of our sons and daughters.
Y creo que hay que trabajar el tema de la educación sexual.
And we need to work on sex ed.
Si no hay educación sexual, es muy difícil que podemos avanzar en una niñez libre de discriminación.
Because without sex ed, it's very difficult to advance for children with no discrimination.
La mayoría de los proyectos que tenemos en la región son proyectos para mujeres de 18 años para arriba.
Most of our projects are for women 18 years old or more.
Y es necesario trabajar desde la niñez, adolescencia y adultas mayores. No podemos dejar a las mujeres adultas y a los hombres adultos mayores afuera de ningún programa.
And we need to work with children, teenagers, and old elder people, men and women, because they shouldn't be excluded.
Quiero agradecerles a todos por la invitación, a la doctora, a mis compañeras y compañeros que están presentes, por darme un espacio y que nos puedan conocer realmente la realidad de Latinoamérica, que es una realidad de exclusión, de migración forzada. Ahí tengo una compañera colombiana de migración forzada y es una región que todavía no conoce la democracia igualitaria.
I want to thank you all for being here, Dr. T, for the invitation, to all my colleagues for sharing this table with me. And I want to say that Latin America is a region of exclusion, forced migration, and we still have to work in our democracy systems.
Gracias.
Thank you very much, Marcela. And please don't ever apologize for not speaking English, ever. Thank you very much for your intervention. And I move now to Kiara St. James, who is a community organizer, public speaker, and the founder and executive director of the New York Transgender Advocacy Group. I'm going to come look for a job soon. A grassroots nonprofit committed to creating new opportunities for trans communities through strategic partnerships and innovative sustainable initiatives. She has led workshops on marginalized communities at the International AIDS Conference in Vienna, the United Nations, and various academic institutions. And her advocacy has been instrumental in reforming shelter policies that discriminated against trans individuals and for the passage of the Gender Expression Non-Discrimination Act, which became law in January 28, 2019, ensuring the creation of culturally affirming spaces for all New Yorkers. And thank you very much, Kiara, for being here with us today. And in terms of building stronger coalitions between trans-led organizations and the broader human rights movement, what have been your experiences? You've worked within the UN, you've done some public speaking as well. I'm sure you have a lot of insights to share with us on that, and also just any other, stuff that has come through for you today. Thank you.
Sure. No, thank you so much. Thank you all for being here. Once again, my name is Kiara St. James, founder, co-director of New Transformation Group. I first want to ground us in history, but first I would like to do an interactive call and response. And it's something I used to say, I haven't said in a while. So just repeat after me. The system is not broken, but it will break us if we do not work together to dismantle. And I also want to ground us in history. I stand on the shoulders of some amazing Black trans women activists, and this is going back to the 19th century. I think about Sarah Jones, who they nicknamed the Monster, who was a sex worker, who when she was brought up and prosecuted on the fact that she was a sex worker, and they found out that she was, the term trans didn't exist back then, but they found out that she had a fax, right? And, the audience laughed, mainly cis white men, they laughed at her when they found this out and saw her to be a spectacle. And her response is, you may laugh, but my community loves. And that is something that's so powerful to me as a Black trans woman, to know that she came from a community that loved and supported her. I also think about Frances Thompson of Memphis, Tennessee. Right after Civil War, she was amongst quite a few Black women who were raped. And when she went to court to testify, once again, they found out that she's trans, right? But that didn't stop her from testifying. And because of her testifying, her and the other Black women, they were able to have some of the first legislations in the country to protect Black women. And so I want to ground us in that because it speaks to how Black trans women have always been social justice warriors and have always stood up for our community. My first identity is Black, African-American, born in Beaumont, Texas. Yes, I'm a Southerner. And so I'm proud of those roots because that's where my foundation is from, right? But I also know that it's important for us to know our history, not only just so we don't repeat it, but to learn from it, right? So the reason I founded my organization is because oftentimes for folks who are not part of the LGBTQIA community, you may not be aware that there is still a lot of racism even in the LGBTQIA community, right? And I often hear from cis Black folks like, oh, well, you folks got it made, you got the white queers taking care of you. And I'm like, ouch. Like, no. And so that was one of the main reasons I founded my organization, is to really to give my community a space to learn about policies and legislations and to address root causes of discrimination. I often tell my folks, my YAF members and my CAB members, that it was through activism that I learned that I did not have to be a victim. And as long as I found my tribe, we're able to create strategy to protect our communities. And so that's something that is still very powerful to me to this day. That's the reason why I get up, even when I'm tired and exhausted, to do this work. I also think about the intersectionality. I want folks to understand that we did not get here by some collective agreement. It was mainly by force, right? We live in a colonized world, right? So the global majority had to conform and fit into a box because cis white men and Western European nations in general did not understand the context of gender expression, gender variations, even skin tone, hair textures. All those things to them became queer, right? So even if you are not trans or queer, LGBT, you still are seen by cis white folks as other, right? Whether they admit it or not, right? And so it's important for us to understand that our duty is to support one another. I fight and I talk often about Black women and infant mortality during pregnancy. Not because I have a uterus, but because I care for my Black sisters and wanted to make sure that they have the best health care as possible. I also stand with my undocumented family because I understand, I had a conversation, this was years ago, with a trans Latina woman in one of our groups. And she was like, you'll never understand the fear of ICE kicking in your door and arresting you in the middle of the night. And I'm like, I'm a Black trans woman, I'm Black, so I do have that experience. I actually had Popo kick in my door. This was years ago. And so there was that commonality that we have. So I do feel it's important for us to work in intersectional spaces for the progress of our collective communities. And also think about the Black Panther Party, which my mother and father were part of. And what I really love was, power to the people. And one of the reasons why we have a patient bill of rights in just about every hospital, it came from the Black Panther, right? Who wanted nothing more than to take care of their people. And because of that, they were demonized and called a terrorist organization. But one of the things I love about the Black Panther Party is that they were very inclusive. They reached out to the young lords. They reached out to, as organization, I think they got the Rednecks or something like that. They reached out to the LGBT community, right? They were inclusive of everyone because they realized and recognized that our liberation is something that we all should be a part of. If you're not free, I'm not free, right? And that's something that we all need to understand. And even today, I think about it, I'm just gonna play on some words from a famous German minister, German pastor, who said, first they came for the gypsies, because I wasn't gypsy, I did nothing, right? So today, first they came for the undocumented, and then they came for the trans. And because folks are not part of those communities, right? But the reality is, white supremacy has no respect for anyone. It devours anyone that supports it. And so we have a responsibility to work together. One of the things that I have always been active and intentional about doing is reaching out to Black faith-based organizations, because I feel it's important for them to understand a little bit more about my community and understand a lot of Black and brown, trans, non-binary folks are very spiritual, are very connected to their foundation, right? If I go to my sister, who's also my Black trans sister, Marissa Miller, who lives in Chicago, the first thing I know she's going to do on that Sunday is hit me up to go to church, right? And so it's very important for us to be connected, right, to other communities, even though you may not be particularly grounded in those communities. That is what it looks like when we fight against white supremacy that seeks to devour all of us and to put us all back in chains, right? That's what Make America Great Again is about. It's to silence us and to erase us. And so we have an obligation to support one another. If you hear someone making transphobic remarks, it's your responsibility to say, don't do that. Respect trans women, respect trans men. I don't know if I'm the one who coined this phrase or this, but I often feel that there is a focus on trans women more so than trans men, give or take, right? And so I kind of coined the term trans misogynoir, right? To talk about why this is of great concern to me. And it's also rooted in the fact that anything that is feminine is seen as less, right? It's, we have to acknowledge that we live in a world that admires masculinity, right? And we have to address our phobia when it comes to all things feminine, right? And that is one of the main reasons why there is this kind of like, in the Black community, I would say the agenda, there's a gay agenda to feminize our men. And the reality is there has always been trans folks in the Black community, queer folks in the Black community. As I mentioned, Frances Thompson, Sarah Jones in the 19th century. And so we have to educate our community that this is not a new thing. My existence didn't just come overnight, right? But the reality is we have social media, so you get to see our presence even more. But the reality is that we have always been here. When I transitioned 25 years ago, which makes me 25 years old, I did not aspire to be trans, because trans wasn't even a term back then. I just aspired to be a femme queen, right? When I first moved here to New York, I saw all these beautiful femme queens, Black and Latina, and I knew that was me. And that was what I wanted to be, and so I find that becoming a social justice activist was out of a need for survival. But also what I've realized is that it is through activism, and only through activism and us being very vigilant, that we're able to see progress and secure rights for everyone. And so what I feel is happening now is we've had so many years of success and progress, right? And so there are communities of every race who, we're human beings. So oftentimes human beings believe in a hierarchy, that somebody has to be on top, right? And the reality is when you can no longer make fun of a people, target them, it causes a lot of resentment. You mean I can't make fun of a queer person, of a trans person? And so for a lot of people, they feel lost because they need to feel like there's somebody lesser than them. And so that's what we're also dealing with, is the fact that, there is fear of change, of the unknown for folks who have always been in power and have always been able to take up space. And now here comes the trans folks, the undocumented folks, Black women, Latino women coming into these spaces, taking up space unapologetically. And that makes a lot of people angry. So we have a responsibility to really work together and to understand that your battle is my battle, right? And so some of the ways that we should collaborate is through just making sure that you send an invitation to trans organizations and say, hey, we're gonna march on DC to demand universal basic income. That's something we all are interested in, right? Universal basic income, and vice versa. I often tell my community, it was a long fight for Gender Expression Non-Discrimination Act. I was there from the very beginning. And I often tell my folks when we finally secured gender back in 2019, perhaps if we reached out to the Black community, the Latinx community, and got them involved in our fight, and we got involved in their fight, we could have had gender a lot sooner. And so the main thing that we have to be intentional about is not working in silos, right? Making sure that you reach out and don't assume because someone is trans, they would not be interested in reproductive justice. Because I'm a parent. I know a lot of trans folks who are parents, and grandparents. And so of course we're interested in reproductive justice. And so that is where it starts. We begin to win when we all see each other's humanity and don't other one another. And so when we talk about how do we collaborate, very simple. If you're gonna have a street party, just make sure you invite everyone. That's how you normalize and get people familiar with other communities, is by creating affirming, brave spaces for all of us. And until we dismantle these silos, this government will continue to do what it has been successful in doing since January 20, right? And so it's up to all of us in this room to understand that our survival is connected to one another. And it's important for us to make sure that we support. If you have a platform to have trans folks in spaces to talk about what our issues are and also what the solutions are to those issues, do that. Just like y'all have invited us up here today, that's really important. My favorite spaces to be in are in spaces that are mixed spaces, because I am part of the community. I'm Black, so of course I connect to the Black. I connect to Africa. I'm African, never been to Africa, but Africa is in me. You know, I'm a woman, you know, I'm trans, you know, and all these, as I said, are deemed as queer, whether we want to acknowledge it or not. And so we have an obligation to just really be there for one another, you know, and I think that's about it.
Thank you very much to all of the panelists, and we have time now for a Q&A session, some comments that you may have as well from the floor to our panelists, including myself. And we have about maybe 20 minutes for that to happen. So feel free to raise your hands. I'll take first round of questions or comments and then allow the panelists to, you know, have a go at that, and then we'll come back for the second round. So I see one hand, two hands, third hand. There we go. Thank you very much. In that order. There you go, Dudu.
I can pass the.
Thank you. Yeah, okay. I'm Tutuzi Delamini from South Africa. I'm a sex worker from Sex Workers Education and Advocacy Task Force. Thank you for the panelists' presentations. And then I'm not a trans, but I'm a supporter. As you finishing saying that if we're working silos and then we're not going to win. And I'm a supporter for trans. I will speak on my context of South Africa. As you know, South Africa has a good constitution and Bill of Rights, but at the moment, trans people, they are facing a lot of challenges. They are facing lots of challenges from their families, they deny, and they move from their families, and then they go stay in South Africa. In the context of South Africa, most of the trans sex workers are staying in outside, they're homeless. And then the other thing that they do not understand, the communities, they do not understand where it's coming from. And then they need to the more education. And the other thing, the lots of trans struggling with hormones at the moment. The special clinics that we're having friendly clinics with them are closed down because of US government cut the funding. And then the fear is that they're not able to go to the public clinics. And I'm not sure what the public clinics have hormones now. And then the other thing, that the stigma and discrimination that they face because they are facing being a trans, being a sex worker, being homeless. And then all those, it's a double discrimination and stigma. And then the other thing is that they are facing is, but also they're not allowed to change their identity. The ID documents for them, they are still called names, main names, and then they are still facing those things. And even they get arrested as a sex worker as in the trust, and then they put them in the same cells with men's, of which they not even open it for them to make calls, taking medication, like carrying condoms. As you know, sex work in South Africa is still criminalized, both client and the buyer and the seller. And then the other thing, I noticed in the first panel, and I noticed that there was one of the panel highlighting the billionaires, they not send funding programs for women's and trans. And actually the issue is that in South Africa, the most trans, they do not have a funding to create their own space and advocate for themselves. And then I need when you're saying that you need to work together to facilitate those spaces, and then you're sharing your experiences and impacts of it, yeah.
And the last thing that I would say, I would be happy in future to see funding instructed in trans, even sex workers themselves, but in trans, most of the time they are kept like away from the programs. Even in my organization, Sex Work Education and Advocacy Task Force, we're focusing on the sex work, but at the same time, we are struggling to get funds direct for trans, and they are still a challenge. We don't able to fundraise for them. I think, yeah.
Thank you for that. I took inspiration when I first founded my organization from India, because India has one of the longest surviving communities called Hijra. And Hijras are not necessarily trans. Some of them are trans identified, but many are not. And what the Indian government did was they set aside funding for Hijras to go to school, right, to get an education. And so that is something that we need to be urging other communities to do. And India is a developing nation as well, right? It's not really considered I don't hate hierarchies, but it's not considered, a first world nation. But yet they recognize the importance in investing in the Hijra population. And that's something definitely I would love to see happen in South Africa and other parts of Africa. I know that Africa have some of the harshest anti-sodomy laws and all that was created mainly when Reagan was in office, right? The ABCs and, these countries would be reprimanded and funding would be pulled if they didn't teach like religious doctrine, and so we have a long way to go to make sure that even in this country, that there is investment in the trans community. But I feel that having these conversations, meeting with your city council members, your elected folks back in South Africa, where it's Durban or Cape Town, it's important for us to engage with our elected officials, right? There are the holy M's of advocacy, I like to call them, and that's micro one-on-one conversations. The mesos, like what we're doing today, and then it's the macro, drawing in our elected officials to be part of our fight and to help implement and change laws. And so that's what really is needed, is for, once you have the conversation with your community at large, find allies who are our elected officials to also help y'all set aside some type of funding for your community. I know it's a long fight, but like I said, it took us 17 years to secure agenda in New York State. But I truly believe that anything worth having is worth fighting for, no matter how long it takes.
Hi, my name is Dr. Molly Mehta, and I currently work at the Gates Institute for Population and Reproductive Health back in Baltimore. I represent a youth-led organization here, which is called the International Student Surgical Network. And my question, before I go ahead, my question is around youth-led initiatives, and I'm a big believer in bringing your own chair to the table when there are not enough chairs on the table, and making your voice heard. So in the current times, like you said, that we all have to be together, and it's a long fight, and it never stops. So in your organization or in any other organization, what are some youth-led initiatives that you've specifically seen that have made an impact and in advancing transgender rights, and strategies that that ensure that youth engagement is not just tokenistic, because it doesn't end there, but is actually bringing meaningful change? I come from India, and what you I was just beaming with pride when you mentioned that example, and it's funny if it's been 2 years since I'm in the US and I feel like I'm going backward when I expected to go forward when I moved to this country. So more than like very curious to know of, what are you asking to the youth, to come forth and do to make sure that we're advancing together forward. Thank you.
I can go first, and then I'll step back and move back. So I'm very proud that we at New York Transgender Advocacy Group, we have a program called YAF, Youth Advisory Fellowship. And the youth in that program are between the ages of 18 and 26. And we felt, and I felt it was very important for us to make sure that we center youth in anything that we do, because, not only are the youth our future, it's important for us to be able to understand what their needs are today, and so we just came back, my YAF folks, we just came back from Albany where we participated in the Advocacy Day. That's very important. I feel like once you are able to engage with your youth and get them to understand that they have so much power, not only individually, but collectively to change the world, it's a beautiful thing to see how their mindset changes from like, I can't do anything, to when do we go to Albany next? Like when are we going to march? When are we going to protest? And so I do believe that it's so important for us to invest in our youth. We also have a CAP because I believe in from the womb to the tomb type of programming, because in the Western world, we've been compartmentalized, right? To where the youth are segregated from the adults are segregated from the senior citizens. In most global communities before colonization, it was always intergenerational. We learned from one another. And so it's important to also have that type of programming, because there's a lot of things, people always think like they're the first to do something. So you need someone in that space as well to let them know like, well, actually, this was done before, but this is how we can learn from their mistakes, right? But I think having youth to really help guide your policies and legislations is so essential, because they are out in the world more so than us older folks are, so they know what's really going on. So invest in our youth is very important.
Thank you. I actually want to as well respond to Dutuza's intervention on South Africa, just to give a kind of a flavor or a understanding of what the scale of the problem is of the US retrieving from so-called ODA, which is Official Development Assistance. So the new US government has wound down US aid for the time being, and has stopped all official development assistance. While this is in the US context a minuscule amount of money in comparison to the overall budget, it's less than 1% of the overall government budget. That move has a gigantic and detrimental effect, in particular on countries on the African continent, in Latin America, as well as in Asia and the Oceania, because that money supports health systems in countries. It supports the fight against HIV, but it as well supports general healthcare systems. So what does that do to trans? And you've mentioned in the case in South Africa, it means that trans persons, as well as persons living with HIV or persons looking for healthcare, will not have access to healthcare anymore on the African continent and in other world regions. And I'm not talking about one or two. I'm talking about scale. I mean, very, very likely, healthcare systems are going to break down in a number of countries due to the cutting of ODA assistance of the US government. And unfortunately, a lot of other so-called donor governments who usually, give money to issues like that are as well cutting their assistance left and right. So, and speaking for the trans and as well the LGBTI movement, large parts of the global LGBTI movement and of LGBTI organizations in global majority countries do depend financially on money from the global north. So my organization, Ilga World, we have 2,000 member organizations in 170 countries. We believe that our movement globally will look very different in a year from now, because many, and I'm not talking about 10 or 20, I'm talking about hundreds of organizations, are not going to survive the next 12 months. Yes. So thank you for your intervention on South Africa. I think South Africa is in exactly the same boat here when it comes to the provision of healthcare, when it comes to the provision of HIV services, when it comes to the provision of trans-related care, as well as when it comes to LGBTI organizing as such. And I think it's unfortunately the case in many other countries as well. On youth, so we have we actually have a dedicated youth member on our board, and we have a committee that deals with youth issues, both in the corners of our board, advising as well the office, like the implementing office, on youth issues. I will as well say then for an LGBT organization, we only work with people of the age of 18 and above. That has historical reasons, and as well, you know, let's say the ghost of the ghost of the pedophilia allegation is haunting us to this day. And that is kind of the core reason why we actually are only working with people who are considered adults in international contexts, which is unfortunate. But as said, so we have a dedicated kind of youth person in the board whose role is it, like dedicated role is it to make sure that everything that we do has, you know, a youth dimension and serves young people.
Yes,
Sí, yo quería reforzar lo que decían mis compañeras. En Latinoamérica sucede lo mismo. USAID, PEPFAR están yendo de la región. El Fondo Mundial también. Ya hay falta de medicamentos, de retrovirales en algunos países. Ya está faltando los retrovirales. Yo creo que vamos a tener un 2025 y 2026 con muchas falta de incidencia política de parte de Naciones Unidas.
I want to reinforce what my colleague said. In Argentina, we are also facing USAID and BFR living. In Latin America, we are facing they are leaving the region. So we are facing lack of medicines, lack of treatment, lack of antiretroviral treatment. And I'm thinking next years, like 2025 and 2026, we are going to experience a lack of advocacy in the region because of that.
Thank you all so much. Muchas gracias, Marcela. I'm thinking a lot about visibility and how in the culture we have now, there's a heightened visibility of trans and queer people. And as a young person, I think it's been really powerful to grow up and see trans and queer people in media and positions of power. But it hasn't necessarily translated to a safety. So I'm wondering how you guys think we can wield this visibility, because I don't think it's necessarily something that will go away. But how can we protect ourselves, but maintain or maybe use this positionality to create material change?
You know, I've never cared for visibility. I always say that I'm a seasoned woman. And so I come from a time where I love that we were like vampires and there were rumors of our existence, but nobody really knew if it was true or not. And now we're like at a point where there's an oversaturation of us everywhere due to social media. And so one of the things I love, and this was actually initiated by a trans Latina and dear sister of mine, who's also from Argentina, Cecilia Gentili, where we're the second state after California to have a trans equity funding written into law. So it's called the Lorena Borjas Wellness and Equity Funding. And Lorena Borjas was an undocumented woman from, I believe she's from Mexico, if I'm not mistaken. And she did a lot of amazing work. She passed away, unfortunately, due to COVID. But we created this funding for our community. And what we're doing right now, we're trying to increase it to 8 million. But one of the things that I do know is important is we still, once again, it's about silos being broken. We still have to educate the overall community, not just our queer youth, but educate, the cis hetero kids as well. That's going to be one of the first ways to normalize and for them to see our humanity. It's for them not to see us, because by the time they graduate from high school, they already have been indoctrinated into a certain type of bias towards queer people, right? And so it's important that there are spaces where youth of every sexual identity, gender expression are able to get to know each other, right? But also with some of this funding, we're actually talking about perhaps creating like a TGNC residency where the community can have a place where they're getting their social service needs met. They're learning how to navigate the mean streets of New York City. The streets of New York City are not as mean as they were when I was a youth. I have to let you know. But I think it's really important that we do address violence. My organization, this would be our 5th year hosting a Protect Black Trans Women rally in Harlem, because between 2020 and 2021, 9 Black trans women were murdered in New York City. Now, New York City is seen as a progressive city. We have all these laws to protect our community, and yet this happened. And there was silence. There was silence from DMHC and all these other organizations that claim that they care for the trans community. And so it's also important for us to, and for you all as well, to ask these other organizations who claim that they support and want to invest in the trans community to get them to do more in regards to employment opportunities and housing opportunities for our community. And so those are some of the ways that we can really start to address it. This is going to be an ongoing issue because, you can't really legislate hate. I think about Martin Luther King Jr. He says, I can't control how, who you hate, but I can control you not being able to lynch me. Right. And so that's one of the reasons why we fight for these type of legislations. And it's just really important to be vocal, even if I don't know if you're trans identified or non-binary, but it's important for you to also be part of the fight, and just really let these organizations know that they need to do more. But most importantly, City Council have meetings monthly or every other month in regards to the trans community and the queer community. That's another place to have your voice and your concerns heard. The more folks who say they want more funding for the trans community, that City Council here, they're like, oh, we need to do more for the community. I do have some good news, that City Council actually is debating on investing an additional $10 to $20 million for trans organizations to help us with not only our funding, but there's been an influx of trans folks and their families coming to New York since Trump got back into office. So there is some good news that City Council recognized that there's a need to invest in the trans community, but we just need, right? It's just important that everybody let them know we need more, right? And so it's just. No, I love that question. So definitely, you can go on the, I think they have like different websites for City Council that you can set up meetings, because you can set up meetings with whoever your representative is. You can set up a meeting with them and say, I really am concerned and want to see what is being done to help the trans community. So it's really about like just creating that type of relationship with your City Council member, right? And what happens is they recognize like, oh, it's not just trans people who are asking about more funding for the community, but it's also their accomplices as well. So like the first step is to set up a meeting with your representative, if you live within New York City, and tell them that this is one of your main concerns.
And I want to, perhaps in the interest of time as well, I don't know if there are any hands, but I want to encourage us to maybe, as we have lunch, to continue having the conversations and sharing links and all of that. But because Marcella, you've also used the law in very strategic ways to defend rights, to protect rights. Perhaps you can give us some ideas, or maybe a lot of in Africa, for example, very right-leaning fundamentalist organizations are now using the courts, right, to take away rights. And so what you can share with us as your experience, as someone who has been using the law and policy to fight for rights in the Latin American country, that can be useful in what
Sí. Primero, hay que trabajar con la comunidad, hay que trabajar con la población, y que la población, en este caso la población trans, tenga bien claro qué son las leyes y para qué se construyen las leyes.
So it is important to have community involvement, but also building capability and capacity within the trans community so they are aware of what the laws are for and how to use them.
Las leyes son para los grupos y las personas más vulnerables.
Laws are for the most vulnerable populations.
Y yo creo que lo que hay que hacer es formar a las personas trans políticamente.
And so I think what we have to focus on is building like a capacity, political capacity for trans people to act.
Que participen en los espacios políticos.
To participate in political spaces.
Que no sea todo LGBT y nada más.
So not everything is LGBT, but like other.
Y hay que saber que las personas trans tienen que acceder a la inclusión laboral.
And trans people have the need also for work inclusion.
Para tener los derechos laborales.
Because labor rights.
El trabajo sexual, la prostitución, tiene fecha de vencimiento.
Sex work has expiration date.
Tiene fecha de vencimiento. Hay que explicarle a las compañeras y compañeros que tienen que estudiar, formarse, capacitarse para entrar al circuito laboral.
So we need to grow capacity, educate, give skills for people to add themselves to the labor market.
La única opción no puede ser el trabajo sexual.
Sex work cannot be their only option.
La ley, lo que tiene que hacer, en Argentina tenemos el cupo laboral trans.
In Argentina, we have a minimum number of trans people who must be in the work market.
Personas trans en el Ministerio de Salud, Ministerio de Educación, entraron a los ministerios.
For different governmental agencies, so trans people have to join, well, are required to join these in a minimum number at least.
Hay que formarlas y prepararlas para esa inclusión. Hay algunas mujeres trans de 40 años que nunca entraron al circuito laboral.
So we need to build capacity because there are 40 years old women who have never been part of the labor market.
Hay que explicarle que hay leyes que le van a dar beneficios.
So we need to explain to them that there are laws protecting their rights.
Jubilación,
retirement,
vivienda,
housing,
créditos.
credits.
Esto es algo personal mío.
This is a personal.
Las mujeres trans tenemos que descolonizarnos.
Trans women need to decolonize themselves.
No existen las Miss Mundos.
Miss World and beauty contests are not okay.
Hay que descolonizar, sacar. No hay Miss, no existen las Miss.
We need to decolonize and get away from these
No
ideas.
podemos nosotras fomentar el machismo y el patriarcado con nuestras compañeras.
We need to stop supporting these ideas that are misogynist and patriarchal.
Yo le explico a mis compañeras que cuando se compraban los esclavos,
I try to explain my colleagues that when slaves were bought,
los blancos elegían quién tenía más diente, más nalga y más pecho.
white people were allowed to choose from among them for who had more teeth, more boobs, more
Y las organizaciones trans no podemos fomentar los concursos de belleza.
For that reason, trans organizations have to step away from these ideas.
Es muy de Estados Unidos, Venezuela, Colombia y otros.
It's a very strong idea in practice in the US, Colombia, and Venezuela, and other places.
Cuando yo vine por primera vez a Estados Unidos, hace 30 años,
When I came to the US for the first time 30 years ago,
dije, wow, Estados Unidos,
I was so impressed by this country.
dinero,
Money.
mucho,
So much money.
divina, así, dije, me encontré con una población
I found myself within a population,
latina
a Latina population,
que andaba así,
who was so hidden,
tapada, sin dinero,
poor.
vivía peor que si vivía en Latinoamérica.
They lived in worse conditions than they would in Latin America.
Entonces, hay que tener mucho cuidado cuando generamos leyes que no llegan realmente a las más necesitadas.
So we need to be extra careful in not creating in laws and legislations that are not reaching the most vulnerable populations.
La ley es transversal. Afros, pueblos originarios, discapacitadas, mujeres adultas mayores, niñas y niñas trans, pobreza, salud, vivienda. Esas son las leyes que todavía no tenemos las personas trans. Nos dan subsidios para callarnos la boca.
So we need to aim for laws that are transversal, that reach to people with disabilities, to children, to poor people, because those are the laws that still trans communities are not enjoying. So, and they are just giving like subsidies and cash transfers to homes now. Thank you.
And I would like to thank, of course, Keelan for those opening remarks, and Kiara, thank you very much. Julia, thank you. Marcela, thank you very much. And Isabel for your expertise in translation. I just want to close. I just want to close with just these brief remarks that the binary conceptualization of gender as strictly being heteronormative creates an assumption that shapes how LGBTQA+ and non-gender conforming persons navigate the social, political, economic, and legal structures, and that imperialist definitions of whiteness fashions itself as a way to move through life. And so it punishes everything and everyone who lives outside of those boundaries and those bounds. Sexual orientation, gender identity, and expression is then seen as a direct threat to whiteness and imperialism, and hence patriarchal, racist, capitalistic, imperialist oppression are part of the continuum of violence and of the conditions facilitating, enabling, and perpetuating the violence against transgender persons and gender non-conforming people. And so as a mandate holder of the UN, I have dedicated my tenure, which is soon coming to an end, to the idea of the restoration of dignity that centers people who are left behind by either systems, policies, laws, or practices. And so to talk about health and the right to health of transgender and gender non-conforming people is to talk about politics, but also resistance. It also is to talk about joy and survival, borrowing from poets that we should remember that many of us in this room were never meant to survive. And so a holistic response from a human rights perspective to advance the right to health of transgender people and gender non-conforming people must address the many contexts, for example, conflict, displacements, humanitarian issues, locations, for example, being in a peri-urban, rural, or urban space, people with different age, especially abilities, physical, and it's important that the approach requires a further examination of how these responses also interrelate with race, ethnicity, minority, political and economic, as well as other status as well. And you've spoken about health status and the intersections of HIV and what the global health cuts are meaning for all of us. And so we know that transgender people experience multiple and intersectional forms of discrimination. And so with that, I borrowed from Audre Lorde, as I always borrow from older, wiser women, Black women, that sometimes we are blessed with being able to choose the time and the arena and the manner of our revolution. But more usually, we must do battle where we are. And today we are seated at this table, we are in this room, and you are part of the revolution because you came today to defend, to protect, to advance the rights of people who are seen not as fully human or deserving of their rights. And by default, you will be seen as disruptive and revolutionary. So welcome, fellow revolutionaries. And in the context of the 30+ anniversary of the Beijing Platform for Action, we have an opportunity to reflect and strengthen and promote transnational unity, empathy, and cooperation and collaboration between all of us. It is important for me to remind you that United Nations member states have a specific and continuing obligation to move as expeditiously and effectively as possible towards the full realization of the right to health. And so we must do battle. We must do battle where we are, and the demand is on all of us as individuals, but also as a collective. I close this in solidarity with all of you all. I share in the deep rage and fury for a multilateral system that continues to completely let all of us down. I'm a mandate holder who started in pandemics. I matured as a mandate holder during a genocide, and I am sick as I sit here today. But I'm here with you to share a deep sense of love and commitment as we move forward, to protect rights, to demand that we are fully seen as human, and that no one, anywhere, should be living under the crushing weight of all of the different ways in which structural discrimination and racism and imperialism works. We will fight like hell because that is all we know, that is all we've ever done, and that's all we promise to keep doing. So thank you very much for being here today.